All right. All right, the October 10th, 2023 meeting of the Anne Arundel County Board of Health is now in session. Each year, twice a year, we actually sit, for most folks that don't know this, serve as the Board of Health for Anne Arundel County. I'm a fan of that. I met with Ms. Gedden here, who will speak briefly or speak here shortly, but I even put it on my business card, so I'm so passionate about our role and responsibility in that capacity. And so I hope at some point in the future, this body certainly deep dives further into that responsibility that they have. But before us, we do have the director, the acting, or the health officer, not acting anymore, who is Tony Gedden, and she will, what's your official title when you're at a board? Is it the executive agent? I think that's what it is, or something. Not that it matters for me from a curiosity standpoint, but I think there's a technical term in there in the state charter. But you are the health officer for the county, and we are pleased to have you. The floor is yours.
All right. Good morning. Okay, so we're going to go ahead and get started. I first wanted to start by acknowledging World Mental Health Day, which is today, which I think is a great time for us to be here. So please, there are bags of goodies with pens and things to recognize the day if you see them. Thank you to the Mental Health Agency for bringing those. I'm going to get right into it. As you mentioned, I'm Tony Gedden. I'm the health officer for the county. Along with me at the table is Deputy Health Officer for Operations, Sean Kane. And behind me are all the folks who work very hard to pull this presentation together behind the scenes, all of the directors for each of the bureaus within the health department, as well as our finance director, director for the Office of Assessment and Planning, and our communications director. So I'd like to thank them all for their hard work in pulling this together today. And as well acknowledging our key partner agencies, the Mental Health Agency. Adrienne Michler is here with us today, along with some of her staff, and Dr. Pam Brown with the Partnership for Children, Youth, and Families. All right, so just a really quick overview. We have about a $82 million operating budget, budgeted for 907 positions, and currently have 783 staff members employed with the health department, and then a list of all of our locations. Just a really brief reminder, we completed our strategic planning process earlier this year. The priorities: reinvigorating our workforce, enhancing our infrastructure, deepening and expanding community partnerships, and advancing health equity. Just as a quick overview, there are work groups created to address all of these issues, and they have started. We hope by the spring we'll actually be into implementing a good deal of the things we think are necessary to move our strategic plan forward. Right, so I'm going to jump right into it, and starting out with gun violence this morning. So as you all know, in 2019, the County Executive's Office decided to move the Gun Violence Task Force into the Health Department to really implement a public health approach, and the Gun Violence Intervention team was born out of that. And so I wanted to start with a little data on homicides and suicides as of this year. And so for this year, we have, as of August, we have surpassed the number of homicides in the county. Last year, we began tracking these numbers in 2016 in partnership with both the city and county police departments, and suicides have also surpassed 2022. We did see a peak, I'll have a slide, of suicides in 2021, so we have not surpassed that, but as of 2022, we are currently ahead of those numbers. So what are we working on in the Gun Violence Intervention team? So a few different things. The strategic plan was released last summer, and the goals you see to the left are the things that we agreed to work on, and what you see on your right are the things that we've actually been able to do since then. So we meet once a month. There are also work groups or subcommittees, data, education, policy, and environment. Those three work groups also meet monthly. So for gun laws, we've been able to put out policy briefs highlighting the evidence of law and laws, ongoing monitoring and testimony, and letter preparation with various laws. For goal 3 of education, we developed a extreme risk protective order, or ERPO, toolkit for the public. We had a community meeting last summer, and people didn't really understand how to use them. Anne Arundel County, it's usually number 1 or 2 in the number of ERPOs issued, which I think is a fantastic thing, but making sure that the public understands what they are, how to utilize them, and when it's appropriate. Also developed a bookmark because of our partnerships with the libraries to talk about GVIT and what we're doing, and a QR code there. We have an ongoing dashboard for our data goals. We're one of the only counties that actually has this, at least from a health department perspective. But looking at things like suicide and homicides, you can find all of that data on our website readily. Also tracking ERPOs through the court system, so not only how many were filed, but how many were actually issued, and working with the police very closely. And then I'll talk quite a bit more about Goal 5, which is community violence disruption. And so as of 2022, in August, we had a cure violence assessment done in the city of Annapolis, and we are just a few days short of hopefully looking at applications from community-based organizations to implement Cure Violence Global in Annapolis City. So again, I'll talk much more about that. We also implemented a gun lock distribution program in partnership with the public libraries, which has been very successful. I'll get into some of the data for that initiative as well, and continue to host our quarterly community meetings. We did have I think everybody had, when the power went out in the city, we had to reschedule. So our quarterly meeting was a little thrown off, but we were able to reschedule it. And then for Goal 6, victim support, this year we were able to host 9 sessions for community experiences and resilience trainings, and offer those trainings to the community. So as I mentioned, I'd get into the data a bit more on the types of gun violence that we're seeing in the county. And so we do track suicides and homicides and then look at it as a total. So if you look at the total number of where we are as of September 2023, we are higher than where we ended the year in 2022. And that number is higher for both suicides and homicides. I want to speak specifically to some of what we're seeing in the city because some of our interventions will be specifically targeted there. It's not the only place in the county that is seeing increased gun violence, so I want to acknowledge that as well. We have seen a higher number of homicides in the city of Annapolis this year than we've seen since 2016. And then for the county, about 42% of the homicides in the county are occurring in Glen Burnie. So that's another area of focus for us. When we look at, I'll get into this slide, when we look at the demographics that are being impacted by gun violence, we really see 2 key demographics. Young Black males are more likely to be the victim of a homicide, and older white males are more likely to be victims of suicide. And so when we are creating interventions and looking at what we can do to impact these populations, it's important that we understand the different demographics, who's being impacted by which type of gun violence, and really picking our interventions and being specific based on the population impacted. So one of those interventions this year was gun lock safety. And so looking at, this came out of a community meeting last summer as well, but to date, I believe we're over 3,100 gun locks now based on the email I got from the library at the end of the week. But each of the public libraries in the county now offers gun locks to residents over the age of 18. You can pick up 2 gun locks. Initially, we started with just a handful of libraries. It was very popular. We had people asking, when is it coming closer to me? And the libraries, because they have ways of, if there's not a book here, sending it over there, we're actually doing that with gun locks. And so we have expanded to all of the libraries. This is just a quick timeline of how that went. So we started in April. With 3 locations. Those locations were based on the gun violence data that we're seeing in the county. So you'll notice Annapolis City and Glen Burnie were the places that we started with this pilot. Expanded in June to 3 additional locations. The health department started giving gun locks out at various community events. In July, we started working with a partner, Man Up and Arundel, who's located in West County, doing some violence prevention work, and they started giving out gun locks. We've also done things like giving them away at school vaccine clinics and our vaccine clinics. We found that parents have been very open and receptive, grandparents as well, to talking about gun safety as it relates to children, and so taking them to places that we know parents and children will be, and the schools have been a wonderful partner with that. And then we expanded to all of the locations in August, and We have also started giving them out at home visits. Our Healthy Start clients, about a third of them, when we tallied them, said they would be interested in receiving a gun lock. So who's picking up the gun locks? So about 92% of these gun locks are going to county residents. And then we see that people are picking them up differently. So most of the gun locks, or most of our white residents, are picking up gun locks at a library, about 91%. When we look at our Black and Hispanic residents, most of them, or a good chunk, are at outreach events and with partners. And so again, knowing our demographics and knowing where individuals are more likely to access a resource is really important for us. And just as an FYI, these gun locks are provided via a grant with the Governor's Office of Crime Control and Prevention, and we have extended that grant, received that grant for FY24, and it'll allow us to purchase about 8,000 more gun locks. They're a little over $2 each, I think about $2.50 per gun lock. Okay, as I mentioned, we were also able to do some community trauma trainings this year. They were hosted in several locations throughout the county, and people understanding what you can do to build your resilience, I think, is important, and how to respond, bless you, after these sorts of tragic events take place in your community. And violence interruption. So what's coming, and where are we in the process? So I mentioned last August we had Cure Violence Global, which is an international organization, come out and do an assessment. We did that in partnership with the Mayor's Office of Annapolis City and various neighborhoods to really look at whether or not this model would be appropriate for Annapolis City, whether or not we had the resources to implement. And as of last August, it was deemed that yes, this would be an appropriate location for a Cure Violence. And so what are they looking at when they do that? They come out, they look at the neighborhoods, they talk to folks like you all, they talk to community members, they talk to community-based organizations. They're looking to see if there's a willingness to do this work, if there are organizations that can do this work, and whether or not the types of violence that are occurring in communities are appropriate for something like interruption. So the example I like to use is if we're seeing individuals being shot in the midst of a robbery, for instance. That's not the type of violence that Cure Violence is going to break up. We're talking about interpersonal violence where you are breaking up retaliation, where there may be cliques or gangs in neighborhoods, and so not where you're looking at you didn't really know the victim, and this was a random incident. We're really looking at relationships and de-escalation. And so I'll get into how we selected the Eastport neighborhood, but I wanted to start with a little bit of data because there were 4 neighborhoods on the list this year that we could have implemented in. But when we looked at both the data and had conversations through community meetings and with other residents, ultimately Eastport Harbor House and Eastport Terrace were selected as the locations. When we're looking at a 1-mile radius of Eastport Terrace, about 74 homicides since 2018. And a 2-mile radius, again, Annapolis is a very small city, you're looking at 141. And so there is concentrated violence happening in these areas, and that's really where we would like to focus. So this year, we went out and talked to each of these neighborhoods. We hosted community meetings and asked them what they thought about this. We tried to describe the program as best we could, gave people the opportunity to ask us questions. We also held 2 stakeholder meetings for elected officials. Thank you to those of you who could attend or found a way to get this information. We heard a lot of different things from the community, some of which was directly related to the violence in their community, and some of it was just general concerns that they have about safety in their community or other ongoing issues like things for children to do, like recreational programs, after-school programs, et cetera, all of which play a role in gun violence. So what did we hear from the residents in Eastport? There is a lot of fatigue from the amount of violence and the fact that it's normalized in their communities. Concerns about the access that children have to guns, as I mentioned, the need for better youth engagement, and the need for privacy when engaging with community members. So we talked about here are a lot of the resources you can access. And people say, yeah, we want to access those, but we don't want our neighbors knowing who's coming out or what's happening. And so also the need for additional resources, employment, mental health, ongoing housing, and drug prevention. So what does violence interruption program look like? So there are lots of different models, but for the most part, they all include these three things: street outreach, program and skills, and coordination. And so street outreach is really a lot of conflict mediation, resource navigation. It's important. I like to make sure that I note this program is here for a very specific reason. It is not the end-all be-all. It's not a complete wraparound. They're not going to do things like if people are looking for employment. They may help navigate you to another resource, but that's not their area of expertise. If you're looking for after-school programming, again, they will be mentoring youth, but it's really not an after-school program. And so there are a number of things that the community still needs in order for this program to really be successful, and they have to partner with other organizations and other government entities that are already in place because they can't, again, do it all. But looking at targeting street outreach, and when we say it's a public health approach, we look at it very much like we would look at another disease process or the transmission of another disease. Who's at highest risk, and what are those indicators for those individuals? So if you've been a victim of gun violence or violence in general, you are more likely to be a perpetrator of violence. Growing up in neighborhoods where you are more exposed to violence. Certain age groups, and as we mentioned before, we look at the demographics and we know that young Black males are more likely to be victims of homicide. So how do we target the outreach efforts and have individuals that look like them and are from the community to really do that work? And then, as I mentioned, programs and skills. A lot of this is making sure that we are connecting people to other things. When you're doing youth mentorship, if they have a particular interest in something, how can we find those resources to help connect individuals? Hosting community events to really normalize decreasing violence in communities, and then coordination. And coordination includes the organization that will be selected themselves, but also the health department coming back to you all to report out, this is what we're seeing. There's a really robust database that comes along with implementing Cure Violence Global, and so we'll have daily, weekly, quarterly, you could really slice the stats any number of different ways on the types of interventions that are happening, and then looking at whether or not that is actually decreasing the violence specific to these neighborhoods. I also want to be clear on these programs are neighborhood specific. So when I have talked about this more broadly, people say, well, they've implemented, in Boston, or they've implemented in Chicago, and there's still gun violence. In the neighborhoods where they're implemented, they see a decrease. It's not a citywide program. Hopefully, because Annapolis is so small, we might see some sort of trickle down, but it is specific to the neighborhood where it is implemented. So we don't anticipate seeing a change in gun violence in Glen Burnie or even another Annapolis neighborhood. As a result, we really will be looking at the violence happening in Eastport, and that's why that initial slide of what's in a 1 and 2 mile radius is important for us. Okay, so the process itself. We started out with sharing a lot of information after the county executive's office approved the funding for this program this year, and we're looking at $450,000 to the community-based organization to do this work and to hire a team. You're looking at a team of 6 to 7 individuals that would include program managers, a site manager, 3 outreach workers, and 3 violence interrupters, and 2 outreach workers. And so we talked to a lot of different groups, and right now we're in the funding and bid process. So the RFA is open until Friday of this week, and then we hope to have applications in from organizations that are interested. We held 2 pre-bidder conferences to help answer questions about the application and what to do, and then we'll move into the selection process. And that process includes a panel. It's not just the health department looking at this, but it will also be a member of the county executive's team, a member of the mayor's office, because we are implementing in public housing in Annapolis City. Melissa Maddox Evans will be a part of that process, as well as 2 community members from these neighborhoods to look at the applications, and we all have a very specific scoring rubric. After that, getting into the hiring process. One of the things that's really key to this is hiring individuals that are from these communities, who are trusted voices, who are known to individuals in the community and understand the makeup of the community and what's happening there. The interviews are also a panel, so it's not just the community-based organization involved in the hiring. We will have a panel very similar to the one that we have to review the applications open for this. One of the things that is often, I don't know, maybe not misunderstood, but that's important that we highlight is this may mean hiring individuals with a criminal background themselves, right? You want them to be in a different space in their life now, but saying that, this is what I did 5 years ago, this is where I am now, actually helps a lot when you're trying to do this sort of work. And then training and onboarding. So a part of the funding that was provided through the county executive's office is also to implement the Cure Violence Global training. And we think that's really important to make sure that we're actually implementing this model with fidelity, and that the community-based organization, just being from Eastport doesn't necessarily make you trained in how to do conflict mediation. It makes you an expert on the Eastport community, but there's a lot more that goes into this to make sure that people can do it safely. And then the reporting. As I mentioned, we'll get a decent amount of data back from this, and we plan to share it back with the community and with stakeholders like yourselves. All right, so completely switching gears into another disease process. Just a quick update on COVID and where we are. I'm going to cover a couple of key slides. We are continuing to see hospitalizations be relatively low compared to where we've seen them previously. There is an uptick. We expected such with the cold and flu season being upon us, but as of now, we're seeing manageable numbers. When we look at booster rates and whether or not individuals are completing those, I think it's important to note that while a lot of people got their primary series, we see numbers for boosters similar to that of what we see with your annual flu vaccine. And so making sure that we're engaging our most vulnerable residents to get those vaccines and encouraging everyone over 6 months old to be vaccinated. But it's important that we note that we do see a marked difference in what we saw previously. The thing I really want to highlight for you all today is what's changed with the end of the public health emergency and that declaration expiring earlier this year. So the biggest change for us is probably the commercialization of vaccines. And what does that mean? So that means that the COVID-19 vaccines now are very similar to every other vaccine. It means that we get vaccines for specific populations, and then for any and everyone else, we have to pay for those as a health department. And so Vaccine for Children's program, we've had it for many, many years, will cover uninsured children who are under 18, or 18 and under. And then there's a program now, because uninsured adults, prior to COVID-19, there really weren't programs or processes for those individuals to be vaccinated at any scale. And so right now, the Bridge Access Program is scheduled to run until early next year, which means that the health department is receiving a small allocation of vaccinations specifically for uninsured or underinsured individuals over the age of 19. I mentioned the Vaccine for Children program, and then our ability to purchase privately. So we are looking at a limited supply of vaccines that we will be purchasing specific to vulnerable populations that we have started to service throughout COVID that we think really need us to continue to come out and meet them where they are, and looking at that cost specifically. We will not be holding very large clinics. It's not, the health department is no longer really the one-stop shop for anybody who may find us most convenient. If you have insurance, we would encourage you to talk to your healthcare provider or to go by your local pharmacy. If you're unable to find one, please let us know, but we're trying to cover some very specific gaps. And those gaps include people experiencing homelessness, our homebound individuals, some of our seniors, and very young children. Some pediatricians' offices are not carrying the vaccine in their office. Pharmacists cannot vaccinate children under 3, and so there's a bit of a gap for some small children. And some pharmacies don't vaccinate children under 12, really, I think more from a staffing perspective and trying to hold down the runners. They don't really have the capacity for that. And so we're also trying to make sure we're closing that gap. Continuing to bring you this slide because I think it's important to note where we are as far as leading causes of death. It's definitely decreased, and we're excited to see that. And it's a positive change from what we've seen over the past 3 years. Now I'll get into some of our more specific services. The Healthy Anne Arundel Coalition, or HAC, in 2023 and 2024 has been focused on mental health and obesity. And so this is a countywide collaborative that's led by the Department of Health. Some of our partners you'll see listed here. It's really a wide range of institutions interested or working in the healthcare space. And so for this year, our mental wellness work group has been able to do a couple of things. In May of 24, and we're starting planning for this soon, so if you know of organizations, we will be having a Mental Health Awareness Month campaign. We were able to do that this year, and it was really successful in getting out what are the events that are happening across the county as it relates to mental health and wellness. Also, really making sure that we are highlighting all of the things that are going on, as well as working to highlight things that we want people to know more about. So the Crisis Warm Line, which I'll talk more about later, and the Network of Care, how are individuals accessing mental health in the county. Also, our Healthy Eating and Active Living work group is working on a number of things to make sure that individuals know what their resources are and how to access them. And then I'll move into our Health Equity and Racial Justice office. We continue to see, and these are just some of the zip codes where we see marked disparities, and wanted you to have this updated slide. We bring this one every time because I think it's important when we do a lot of heat maps in the health department, and most often you will see the areas that have lower incomes, higher proportions of minority residents, and lower education are also the places where we're seeing the health disparities. These are the same places we see gun violence. These are the same places we saw more cases of COVID-19. They're the places that we see more asthma and lead. It's every health condition kind of through and through. We see the same things. Okay, and life expectancy. Again, where you live and what you have access to matters, even within a county. We're looking at a 15-year age gap between Brooklyn and Arnold, or 15-year, life expectancy difference. And so one of the things that we're doing out of the Office of Health Equity and Racial Justice is we have a group of community health workers that do a really fantastic job of getting out to talk to the community about what their concerns are, sharing resources, and making sure that we're in touch with what they need. They do one of the things that I've found most useful is the surveys that they complete with the community. And you see some of that information listed here. And it changes over time. When we first started this, obviously COVID was a much bigger concern for people. Now we're seeing economic stress, substance use, and mental health stigma as being things that are really concerns for community members. So then we try to make sure that what we're putting out into the community matches what they're saying their concerns and their needs are. And so you see some of that. We have an ongoing monthly forum. We invite anyone to join. It's open to the public. It's streamed live. But these are some of the topics that we've been able to cover at our Health Equity Forum. We also have a really wonderful, robust group of partners that come out to present. So some of these presentations are health department presentations, and others are experts from other areas that come to talk to us about various inequities in the community. One of the other things that we're doing out of this office is our Community Health Ambassadors program. I think you all have become familiar with this over the last few years. It really started with COVID-19 and focusing on communities that were disproportionately impacted, but we've been able to scale the program and change it to also include mental health last year. And so doing a lot to make sure, and these are our wonderful partners here listed with their logos, but doing a lot to change mental health awareness and stigma within minority communities specifically. We've been able to reach a little over 25,000 community members. So what did we do to actually impact mental health? So Again, our partnership with the Mental Health Agency, they were able to provide mental health first aid training to all of the community health ambassadors. And so that's 24 different individuals that were trained, which is fantastic. And then what they've been able to do from that is host community members and trainings. So we also have been able to train 163 community members. We hope to scale that further this year. There are some community health ambassadors who will become trainers themselves. So again, getting more mental health first aid training out into the community and expanding those initiatives. And so what are they focusing on? So in FY23, we focused on a lot on mental health and many different things that kind of fall within that bucket, along with making sure that individuals were getting their boosters. For FY24, we've expanded into some things that we're seeing. Community safety, extreme weather preparedness, still making sure that individuals are getting appropriately vaccinated for COVID, continuing with our behavioral health efforts, and also access to care. There have been a number of changes with things like Medicaid and Medicare this year, also expansions in access to care for pregnant women. And so making sure that these communities are aware of what needs to happen in order to have appropriate access to insurance coverage is crucial. So these are just some of the topics that we're able to pick up as we see. Weather preparedness is one of the ones that I'm really excited about. As we see temperatures consistently changing, how are people prepared for that? What do they know to do? We do every year see a number of deaths related to either high temperatures, or in the winter we do see deaths related to freezing temperatures. And so how are we preparing the community? What are we giving them? And partnering with our offices of emergency management to make sure that we're meeting the community where they are. So again, this is just another little snippet of how we've expanded from FY23 to the topics covered in FY24 by the community health ambassadors and some of the partners that we have in order to do that work. Okay, talking about our role as part of the local behavioral health authority. So the local behavioral health authority is comprised of the health department and the mental health agency here in Anne Arundel County. And what are we working on? So working on a community plan for 2024 to 2026, focusing on education and prevention, quality, equity, and access. Education and prevention has been something we've talked a lot about because we often talk about treatment and recovery, which are also really key parts to substance misuse, but we want to make sure that we're focusing on prevention, both on the mental health side and the substance use side, because when we're seeing children, and I think we're seeing a lot more of this and everyone is hearing it, how do you get resources for young kids? These are things that we have to start really early. Prevention starts early, and if we're not doing that work, then we're kind of chasing our tails, and we have to think more upstream about what sorts of things we're doing, particularly with young kids, but not just with young children, also adults, in teaching coping skills and resiliency skills, and how to access mental health when you need it and understanding what's available to you. And so these are just 4 of the areas that they'll be prioritizing this year. They put a tremendous amount of work into this plan, talking with a lot of community members and providers to really determine what the needs are as we continue to see a shortage of this workforce. I think figuring out the best ways to do this work and how to keep the quality going is going to be imperative. So a little over, well, not quite a month, they hosted a behavioral health symposium, The Power of Connection, very successful, a little under 200 attendees were there, but really talking about this plan and also focusing on things like trauma-informed resiliency, depression and mental health in African-American men, considerations for LGBTQ and gender-affirming care, social drivers of health and better outcomes, and connecting wellness, well-being, and neuroscience. And so this was a hybrid meeting, but we had a wonderful turnout in person and online, and I really want to commend both Adrian and Sandy for their hard work and their team's hard work in pulling this together. I'll talk a little bit more about behavioral health within the health department and what we're doing. So one of the things that we've been doing is Be Well AA, which is embracing mental health. And so thinking about how you increase your emotional literacy, how you engage in help-seeking behaviors, what are the types of practices that you can do on an everyday basis to help with your well-being, and then how are we reducing stigma and increasing awareness. And this campaign has been going on for quite a while now, actually. A topic that I'm sure I'll be coming back to you with more in the future, cannabis. So with the legalization, this is something that we are looking at from a behavioral health perspective in thinking about safety, just as we would with any other substance. Thinking about safety, how people are using it, and how we're making sure that they understand what's happening. So there's not a lot of data just yet. One thing that we are able to take a look at is hospitalizations. And what we found fascinating when we pulled this data is that the increase in cannabis-related hospitalizations actually started prior to legalization. So looking back earlier this year, there's a lot of guesses, nothing substantiated as to why that is. Some people think it's just with legalization that people then find it more socially acceptable. So no matter where it's coming from, so the dispensaries weren't necessarily open yet, but people's willingness and openness to using cannabis. And so making sure that we're explaining to the public to start slow and start low and go slow. If you are not a regular user, making sure that parents know how to safely store it away from children is one of the things that we'll probably be focusing really heavily on, particularly with edibles. Those sorts of things, if it looks like candy and it tastes a little bit like candy, children are not going to know the difference. And so making sure that we're talking about how to safely store these items and how to recognize if you've taken too much and what to do, or recognize symptoms in young children. So we'll continue to follow this, and we'll be talking about how to safely engage and making sure that people have all the tools that they need. There's not a lot of research because it's still illegal federally. When we get questions about like, what are the impacts on pregnant women, or how does this impact children? Because it's illegal federally, there's not a lot of research that's allowed or funded. And so we don't have a lot of answers to those questions. It's something I think we'll learn more about as time moves on, but just want to be kind of clear in what we have actual specific answers to and what we don't at this point. I wanted to highlight our Wellmobile, which continues to really do fantastic work every week in initiating treatment for buprenorphine services, as well as incorporating STI and HIV testing, naloxone distribution, and syringe services. And so we are spread out throughout the county now. The Severn Intergenerational Center started not too long ago, but we're on the road Monday through Friday and seeing people in different locations and trying to bring services to where people are versus saying, please come to us. And working with people from a harm reduction model of where are you right now and what can we do to help you wherever you happen to be. The opioid intervention team, I do want to note that we have been talking about the title of this particular team. What we're seeing with fentanyl, and just understanding that there's a number of different substances out there that now you may not consider yourself an opioid user, but an opioid may be in the substance that you're using. Also thinking about people with polysubstance use and what does that mean and what does it look like. And so making sure that when we're talking to the public that they understand whether or not you consider yourself a part of this bucket or not, the messaging and the things that we're saying about substance use apply to you. The safety precautions we'd like you to take apply. And so thinking about how we're using the term opioid and who may include themselves in that conversation and who may not, and just how are we working through that. So this team is an integrated team with a lot of different county agencies, city agencies, community organizations, faith-based organizations, and I think most importantly, having people who are in recovery and family members is crucial, because when we're talking about what are the interventions that we should be doing or what can we implement, having that lived experience voice at the table is something that we cannot do this without. This dashboard is always readily available, but looking at overdoses specifically in the county. And one thing that I want to make sure that we note is while we've seen a slight decrease in the number of overdoses, we've seen a tremendous decrease in the number of fatal overdoses. And I'm going to talk more about, I think there's a number of interventions that have led to this, but one that is really, really important is the use of naloxone within the community. And so while we have not seen the decrease that we might like in overall overdoses, people are surviving, and that is crucial. Just a little bit more about our partnership with the detention centers. So there's a new well-mobile, as you'll see down there with all the pretty colors in the right box, bringing services into our jails is really crucial. And we'll talk more about what that looks like, but this mobile unit allows us to really take the services to both of the detention centers equally, and to make sure that we are without a lot of the infrastructure that's required. This is a heavily, heavily regulated, I actually don't know the number of regulatory bodies that oversee medication-assisted treatment programs, particularly in detention centers, but as we kind of check all of the boxes for what they need us to do to make this happen, this was a much more cost-effective alternative to doing this work than actually building it out within the jail, which is what we have at the other location. I want to talk to you a good deal this morning about harm reduction, what it is, and what we're trying to do in this space. So as just a general set, we do harm reduction in a lot of different spaces, right? When we tell people to wear sunscreen, doesn't mean that it eliminates your risk for cancer, but it is a harm reduction piece. You may still be out in the sun more than we would recommend. Maybe you don't have the hat on. All of the things that you may layer on top of an intervention to reduce harm to an individual is really how we probably talk more about it in substance use than anywhere else, and the way that we talk about it. And so when I say that we're a harm reduction model, that means if you are not ready today to stop using, what can we do to keep you safe? And that may mean naloxone, that may mean fentanyl test strips so you know what's in the substance that you're taking. That may mean our syringe services program to make sure that the needle that you're using is safe. And so all of these things are important for us to do from a health perspective in making sure that people are safe as they continue on their journey, and whether or not they're ready to fully engage in recovery or not. And so we created a harm reduction advisory council. So as we look at new interventions and things to take into the community, we wanted to talk to different individuals, including those with lived experience and people who are actively using, to make sure that we are hitting as close as possible to the things that they think will be effective in the community. And so they've been focusing on 5 key areas: community partnership, engagement, education, awareness, service delivery, research and data, and equity, and making sure that as we are rolling interventions out, we are considering all of these things. And so a new intervention that's coming to any number of locations near you soon is naloxone dispensing machines. And these machines, that's a mock-up of what they will look like. But what we're really looking to do with these machines, naloxone is now an over-the-counter medication. What that means is that if you've got about $48, you can go buy a dose. If you don't, making sure that you either still have a prescription, which for a number of people actually makes it cheaper to access. If it is a prescription, because your copay was likely cheaper than that, or you had no copay at all. And so making sure that the community still has readily available access to naloxone. We will continue all of the interventions that we've had to date in putting naloxone out. But this is one where we really want to partner with other county agencies, and we thank them for their partnership, to get naloxone out. Some of the other things that will be in these machines will be masks for individuals this year, hygiene kits, COVID-19 test kits, and fentanyl test strips. So fentanyl test strips just means something you can use to see if fentanyl is in the drug that you're about to take. And so people can make a decision, an informed decision. So we have funding, OD2A or overdose data to action funds to purchase 6 machines. We purchased the 7th machine, and you'll see in a moment kind of why we wanted to do 7. But using these machines to strategically place them throughout the county. So the darker blue areas are where we see higher rates of overdose. And we have been in conversation with other county agencies and partners to really think about where to put these machines and how to get them out to the public. And so one of the first partners that we talked to about this are our partners in corrections. Many people leave corrections depending on how long they've been there, and one of the first things that people do maybe when they are getting out is to use, and we want people to do that safely. We want you to have a dose of naloxone on your person. Also talking to the libraries, again, tremendous partners with us in a number of different things, but looking at either the Brooklyn Park or Glen Burnie Library, as you see on the map, there's kind of no wrong location there, but thinking about where other services are located. Also the Deal Library. While this is not one of the darker areas on the map, from a geographic equity standpoint, we didn't want folks in South County to have to drive, to Annapolis to access the closest machine. And then looking at the Intergenerational Center for West County, and also still a TBD on the location for Annapolis City. But as you see, we've used the data on where we're seeing the highest number of overdoses to determine where these machines will go. Initially, we do not have a specific launch date as of yet. When we have it, we will let you know. And there'll be much more communication about it, but wanted folks to have an opportunity today to go back, see what these machines will look like, and to understand the purpose of what we're trying to do in the community. One statistic, and I want to make sure I get this right, so I will go to my notes because I think I highlighted this. In calendar year 2022, less than 30% of fatal overdoses were administered Narcan, while nearly 95% of non-fatal overdoses received a dose of Narcan. And so really understanding the impact that this medication is having on people's ability to survive an overdose, and why we want to make sure that it is out in the community because it does work. These machines will be cost-free to residents. You don't slide your card, you don't put any money in, you press the buttons and the materials will drop down. Wanted to talk more about suicide prevention initiatives because we are expanding those this year. We have hired a full-time suicide prevention coordinator, which we're very excited about, but also training staff and community members in evidence-based suicide prevention programs. As I mentioned earlier, some of what we're trying to focus on is more on the prevention side, and so understanding what are the programs and initiatives that will have an impact on that, and how can we implement more of them. So more to come here. Our suicide prevention coordinator, I believe, has been on staff for about 2 months. They've hit the ground running, but there's much more work to do. This also relates to another initiative that was put into place a while back, but it's been a stop and start process. But we have restarted in April of this year with suicide and conflict resolution literature in our gun retailers. And so to date, we're a little over 53,000 brochures that have been distributed out this year. We've started looking at what's happening and whether or not organizations are giving them out, and we're really excited about that. But also there have been, and these are included in your folders, some legal briefs that have come out in support of the work that we're doing, including a number of major medical societies. So the American Academy of Pediatrics and the American Medical Association. I really encourage you to read those briefs. A number of them are providers who are taking care of gunshot victims in hospitals. A number of them are gun owners themselves. They have some really interesting perspectives on this literature and what we're doing and why it's necessary and why there is a public health need with gun safety and providing the appropriate educational resources. So talking a little bit more about our overdose work, we're really excited and proud of this work, that we have a team of 2 peer support specialists who are responding 7 days a week to non-fatal overdoses. So if we get a report that there has been an overdose in the county, this team will reach out to you. Whether or not people are ready and responsive to that, it varies, but we are trying to reach out to all overdoses in the county and linking people to services. And again, if you're not ready for services, making sure you have the information if you get to a place where you're ready to start your recovery journey. And then wanted to share some of the things that the Mental Health Agency is doing with crisis. This chart really goes through what we're seeing and the unique number of individuals served through these entities. We've continued to see the warm line being highly utilized, safe stations, the crisis team, hospital diversion. There are a number of different initiatives here that I think, and when you look at over the past 3 years where we've been, it underscores what we're seeing in the community and hearing from folks as their ability to access mental health resources in the community. Okay, 988. So this is a new number, relatively new, launched last year, but we didn't know what we would see with the warm line. I'll go back. We haven't really seen any change. It's gone up, which is, we want people calling the number, but there was a question when 988 rolled out. What will it mean for the warm line? Will we still need these services? And we do. I think we need both. And so getting as many numbers out to folks as we can and having people on the other end ready to respond. And so what is crisis response doing in filling the gaps? These are just a list of the different services that they're offering and where they're offering things. They have a number of different partnerships, and I think the work that they do is really nationally recognized as a fantastic model for how to do this work. And so I want to commend them for being really 24/7 on the ground, but making sure that people have what they need when they need it. Here's a bit more, if you're looking kind of from month to month, what they're seeing. The blue line is your FY18 to FY22 average, and then where we are for FY23. But again, the warm line, it's 118% higher than what we've seen in the previous 5 years average. So definitely a continued needed service. And then the dispatch of the mobile crisis team. Here's just a little bit on where we were for the last 5 years and where we are today. The professionals on the ground note that the acuity of mental health has been increasing and the cases are getting more complex. And so while we might see, and we're not quite over for, but while we might see a decrease, noting that the cases are complicated and the acuity is high, I think is really important in what they're up against when they're out there. And then safe stations, another really important initiative, and where we are to date with that program. Moving on to children. I think when we spoke last at the last Board of Health, we talked about what are we seeing as it relates to children? What do the numbers look like? So we're down just slightly from FY22. I don't think that necessarily means that the need has decreased, but we're hoping that families are accessing services a number of different ways, and it's a very small decrease from FY22 to 23, which is still much, much higher than what we were seeing pre-pandemic. And then also the crisis team addressing community violence. This is an ongoing topic, I think, for all of us, but having the crisis intervention team providing support and resources, piloting things with our police department, and police.
Can you pause
Yeah.
real quick? And just because I know we got Just want to ask one brief question, because I'm looking at the data and the numbers as they continue to increase. Is there a correlation between the increase in population that also impacts these numbers? Because we're saying we're doing all these things, the numbers are increasing, but that's primarily because our population is increasing. So has that sort of analysis been done?
Yeah, that's a question I'd have to take back to the mental health agency, because again, you're looking at, I agree with you, you're looking at a raw number versus a rate.
Right, correct.
And so we'd have to really look at this in a different way in order to tell you what that correlation is and what, the number of calls that we're getting. But I think that's something we can definitely take a look at with the population growth and see if, my guess is the growth that we've seen from 19 to 22 is not population specific. I don't know that the population has grown enough that it should be this sharp, but whether or not what proportion of that change it makes up is a good question.
Sure.
Okay, I'm gonna keep moving. This is also from the mental health agency, but looking at, I mentioned that they train the community health ambassadors. They're also providing training to a whole litany of groups, but AACPS administrators and librarians. They've also trained our school health nurses and health aides, teachers, faith-based communities, and this is just a snippet of what they're doing to get that training out there to the community and some of the other trainings that they're offering. And then I'm going to move into our Healthy Communities program, and this program is a combination of our health centers and what used to be COVID operations, which is a much, much smaller team. But as I mentioned, going out to our homebound residents, focusing on our people experiencing homelessness and some of our vulnerable populations, and how are we going about doing that, and the services that they are offering are listed here on your right. Here's a few numbers, things that we weren't doing before in the same way. So vaccination clinics at schools after hours. We're currently offering flu mist at 33 schools. And that's something that we were able to do before, but it required a lot of time and effort from the school nurses. So we're able to partner a little bit better within the health department to pull those things together. And then again, making sure that we are serving our seniors, our homeless populations, also our populations in corrections. And so this is just a little bit of what we've been able to do and will continue to do despite the commercialization of vaccinations. We want to make sure that some of these key populations who may have trouble accessing vaccines through other means, or it's really difficult to do, are still being serviced by the health department. We are continuing to watch particularly syphilis. It's going up in the community and has led to additional congenital syphilis cases in newborns, which is something that's really concerning for us. We hadn't seen cases in a number of years. And so continuing to watch that. The data breach of the state has made some of that data quite delayed, but we're continuing to keep our eyes out there and looking at how we can and where we can provide safe sex kits to the community and referring individuals to treatment. And we do have a rapid syphilis test now, which is very exciting. Here's just another couple of numbers on, I think when people think about this particular team, disease prevention and management, it became so synonymous with COVID, but they were doing a number of things prior to COVID that we still continue to do. So disease investigations for all sorts of communicable diseases, looking at outbreaks we do a lot of outbreaks in daycares and nursing homes. So again, your vulnerable population, rabies exposure, we get a lot of that, and making sure that we're appropriately responding to those. I'm going to skip over what we're doing with the food bank and touch on, because we've talked quite a bit about this, the South County Food Assessment and the themes that were identified. The full report is in your folders, but what we saw from individuals is they would like more places to buy food within walking distance of their home, make more fresh and whole foods readily available in the existing stores, and the cost. And so understanding accessibility, also the range of foods that are culturally significant to populations was something that was noted. And so what are we doing now? We are looking at making sure that folks have seen this report and understand what the specific barriers the community's reporting are, but also looking at grant opportunities and what sort of interventions can we support in South County to help address their food concerns. Okay, we're gonna move into, I'm gonna skip over our Healthy Start program. Please feel free to read that. But moving into maternal mortality rates, so we did update this data a bit. Continuing to see, and apologies for the data lag, I really wish things were a lot faster in a number of areas, but continuing to see a marked disparity between non-Hispanic Black women and really all other populations in mortality rates. And so what are we doing to address that? There's a couple of things I want to highlight, so I'm going to move. I think this slide is important because you can't separate the maternal outcomes from what happens with infants. And so looking at what are the things, particularly prematurity, what are the things that are happening with infants and leading to lifelong potential health outcomes for those individuals are important. This data has also been updated a little bit with the particular risk factors that we're seeing in infant mortality and preterm births. Okay. So what are we as a health department doing to look at this, and what is our role in this space? I think there's a few different things. When we look at what the research shows is impactful and effective in changing some of these outcomes, the use of doulas, who are really like birth coaches. They are not midwives. That is its own specific field. They are not necessarily licensed individuals, but what they do bring to the table is the ability to help parents advocate for themselves. They bring education. They bring support for those individuals, and we do see in the research that it makes a difference when doulas are involved. Implementing educational campaigns, performing outreach, and next month we will be kicking off a maternal and infant health task force for the county. So in the next slide, this is a PSA that we've had out this year, highlighting Chanel, who's fantastic for being willing to share her story. I think the volume isn't connected. I'll give you a brief overview for Chanel. She's in her early 30s, having, I believe this was her second child, and was experiencing what she felt were some strange symptoms. Kind of told you'll be okay, it's fine, this is normal, or it'll subside. Her mother advocated and said something's really not right. She had actually had a stroke and almost lost her life and is left with some debilitating outcomes from this. And so making sure that women understand their ability to advocate for themselves, what the outcomes are, what it really takes to advocate for yourself when you're not necessarily the expert in talking to medical providers, but you're the expert on you. And so what does that mean when you feel like something really isn't right? So the maternal and infant health task force that will be kicking off November 9th will be co-chaired by myself and Dr. Monica Jones, who is the head of OB and pediatrics for Luminous. We're very excited to have her. And then here are some of the other partners listed below that will be joining us at that table. In addition to this, having a community-based, a CAB, Community Advisory Board is going to be really important. I think in all of the work that we do, just as we do with harm reduction in other areas, having that lived experience and understanding what the community thinks is important, and not just us saying this is what's best for you, is going to be crucial. Okay, I'll move to the next slide. Please, if you do have an opportunity, that PSA is on our website. Childhood asthma and lead is a relatively new program, kicked off in March. So when I was here to speak with you last, we hadn't done much work yet. But since then, we've been able to visit 110 families. And what are we doing specifically with asthma? So educating parents on how to reduce exposures, and how to manage asthma symptoms, how to use, and educating parents and children on how to use their spacers and controllers. What we see, actually the group that is most likely to have adverse effects from asthma and potentially pass away from asthma are your 12 to 13-year-olds. They think they know what they're doing. They don't often know what they're doing. They may not want their parents still involved. And so how are we educating that group? The younger kids still have a lot of parental involvement. The older ones have actually figured out how to do it, but looking at that age group and making sure that we are addressing their needs. And we'll share one of the workers, the educators in this program shared with me a little bag that she's created to educate about things like sweeping. And if you're a child with asthma, that dust triggers your allergies or your asthma, you probably shouldn't be sweeping. And so she has this little bag with all of the things that she educates the children on. And there's a child about that age who wouldn't really listen to anything his parents said, because what do they know? It's his asthma. But the parents really thanked her for coming out, because he did listen to her. He did say, okay, I think the air quality out today over the summer is probably not a good day for me. And things like that. Whereas before, it is hard when you're 12 or 13 to say, I'm not going to go out with my friends and understand your disease process. But I really commend them for that work. And lead, we've seen some really interesting things with lead, and we're continuing to try to educate on the use of cultural spices and pottery containing lead, because we see a disparity amongst Asian children where spices and pottery are coming from other countries and have a high level of lead in them, and parents don't really know. So it's not the typical chipping paint or something in a home. It's spices, and people don't always know that. And so it's also really getting into educate there and making sure that people are being continually tested. Here's a little bit, as I mentioned before, where we tend to see our disparities in the county. Asthma patients by zip code and their emergency department use. We see a marked disparity between Black children in the county being 2 times as likely to visit the ED for asthma compared to all other children combined. And so as we look at who we're servicing in these programs, this is a state-supported program, making sure that we are trying to reach minority communities. And here's a little bit on what we see with lead. Again, these are in the top right corner, the types of exposure. So oftentimes we don't know the exact exposure and we're not able to pinpoint it, but you'll see what we've labeled as cultural tends to be spices or pottery, which is the second biggest after unknown. And so continuing to educate. Our dental program, I'm gonna get into our sealant program because we do a lot of fantastic work within the schools with 3rd graders. We're in 15 community schools and growing, and just trying to make sure that we capture this group. We found that 4th graders tend to have too many cavities, 2nd graders won't sit still, 3rd graders is the right spot. And so we continue to go out and provide these services, and we've seen almost a 50% increase this year in the parents that are taking us up on it and kids participating in the program. I want to touch briefly on medical assistance and the work that we're doing, again, with the end of the public health emergency. Medicaid renewals are no longer automatic, and so making sure that folks understand that they do have to go back, fill out those applications, and go through those processes the way that they had to previously. A number of folks, we don't want people being dropped from their insurance coverage, and so what are we doing to really address that? So a number of campaigns, we've extended our hours, hired 2 additional case managers to address this. And so looking at the zip codes most affected are 21061 and 21060, and trying to focus there to be, again, data-driven as to where we're putting out these, where we're putting our efforts and where we're addressing the community's needs. And then one of the really exciting things, and I know it's a small bullet point down here, but the Healthy Babies Equity Act that went live in July of this year, providing prenatal and little postnatal care for uninsured, primarily undocumented women. We've seen 450 people take us up on that and coming out and taking advantage of that program and getting enrolled, which I think hopefully will play a tremendous effort in not only the outcomes of those mothers, but also the children. Speaking of kids, we're going to move into our school health numbers. Just a really brief overview of what they're seeing in the school health rooms. There's a lot of education happening. We also do things like home visits with our Birth to 5 program, health screenings, crisis interventions, and then there's a lot of chronic care that's happening in health rooms. So when you look at some of the chronic health conditions that we're serving and the number of children in the Anne Arundel County school system that have various conditions that we're supporting every day. Something new this year that's really exciting is a partnership between the Department of Health, Total Health Care, which is a federally qualified health center, and AACPS, is launching a telehealth program in Tyler Heights and Van Bocklen Elementary School. And so what will this mean? It means that the little camera you see in the picture there, that's an actual picture of the device that will be in our health rooms. Our school health nurses, if a child, and oftentimes we do say you need to go home because you're sick, and sometimes we'll recommend that your parent take you to see a provider. If we're making that recommendation and you signed up for this program, Total Health Care will be on the other side of the computer. And the nurse we have the ability to include the parent in that conversation if they're available. So it's like a three-way telehealth visit, the school health nurse and the child, the provider from Total Health Care, and the parent. And the equipment that's been purchased allows for the nurse to help the provider assess the child. So there's an otoscope, a stethoscope, things that they can see what's happening from their side. As a federally qualified health center, Total Health Care will see people regardless of their ability to pay. They also have a pharmacy delivery program, which we think is fantastic. So if the kid is then prescribed a medication, it can be delivered to their home. Again, we hope eliminating some of the barriers to access and things that get in the way for parents actually being able to take that child to school. So instead of you coming to pick them up and then figuring out when you can get them either in urgent care or to their provider's office, hopefully you just take them home and the meds will come to you, eliminating a lot of the work for kids, hopefully less missed school time, and hopefully making it easier for a lot of parents that we know taking time off isn't simple, making the time unexpectedly for these things. And so starting in these 2 schools as a pilot, and we will see what happens and whether or not we're able to expand it. But we'd really like to. It's very new, but very exciting. And we think kids in these areas, specifically working with the community schools, is going to be crucial. So just a little bit on our vision and screening programs. Some of the things that we focus on are making sure that kids actually get the follow-up. So if we screen you and say that you need glasses or you need to go see an ophthalmologist or an optometrist, how many of those kids are actually following up is something that we continue to track. Same thing for our hearing screenings. And then one thing I wanted to touch on, because we talked a good deal about it during our budget meeting earlier this year, turnover rates by year for school employees, and so school health employees. You'll see we have 315 FTEs roughly, and how many of them have resigned in the last 15 months? So 217, which means we got a very new workforce on a regular basis. The school year is relatively new, so we'll continue to track this for the the 23-24 school year, but this is something that we are actively working with the county executive's office and the finance team to really map out what's possible. And so we surveyed the staff to ask them, what's most important to you? What's salary and benefits? Is it benefits? Is it salary? We know that there's not the ability to always do everything at once, and so understanding what's important to these staff members, and the vast majority of them, I think we had almost a 99-point-something% completion rate of our survey. So this is just one of the questions that was asked, but we do see that benefits are important to the staff. So again, we'll be looking at various models for the upcoming budget cycle to see what's possible and what we can do to continue to support these crucial services. But what does it mean when you have a turnover rate that high? It means that our school health staff have done a tremendous job because what we don't have is a bunch of vacancies. So I have to commend them for creating systems, hosting job fairs, sending out mailers to every nurse in the county, holding listening sessions and informational sessions, and creating recruitment videos. Most of these are tools that we did not use before. We didn't have to, but also some of them are good things that we should keep going. This gives you a little snapshot into how many applications we're looking through to actually hire these individuals, how many interviews are done, and so it has, we have created more workforce in order to just manage the turnover, the hiring, the training, the onboarding, which is significant. Right, and then I'm going to move into environmental health. This is just a snapshot, and I know that you all are well aware of a number of these. I think environmental health is probably the thing I hear most about from the council, either rodents or food services, licenses, sewage and septic tanks, and so I want to give them a little time this morning. And the number of inspections for licensed food services facilities and re-inspections, and then they also investigate every single complaint that we get. So if you lodge a complaint with the health department about a restaurant or food service facility, we will be out to look at it and talk to them. Rodent control, something new for 2023, is expanding services into Annapolis City. So Eastport Terrace, Harbor House, and Robinwood. We've been able to partner with the city because we don't have the same sorts of enforcement authority in the city for some of this and the follow-up work. But I think we've created some really great partnerships, and we've been able to go out and assess those properties, provide the right types of education, and so we're excited about that. And then what are we doing, and what can we offer to communities? Again, I've had this conversation with a number of folks, but we have free pesticide services, and we can also come out, and education is probably the most crucial part. When I sat down earlier this year to talk to this team, they want people to know that if you don't clean up dog poop, rats like dog poop. Bird feeders can also bring rats. Things like that the community is not always aware of. What does it look like if you have burrows and trash? And so just making sure that they know what they can be doing to really eliminate some of the factors that will bring more rodents and pests to your home.
Definitely looking forward to working with you on some implementation in Brooklyn Park, just putting that on the record.
How many properties were we able to survey this year? So a little over 6,500, almost 500 free pesticide services were provided, and then as of early September, 4,100 property assessments and 1,200 violations and investigations, so they are busy. And about 500 of those were rodents, for those who are more interested in rodents versus improper trash storage, but they go hand in hand. And so these are things, and these are some of our staff members actually out taking a look. I review these pretty much every day. I get reports from this team of violations and citations that are going out. And so continuing, and they start with education. They talk to homeowners quite a bit before we ever get to the place of citations. But it not only impacts you as an individual, and as you mentioned, Brooklyn Park, when you're talking about more people in smaller spaces and alleys and row homes or townhouses, it's really important that we address this from a neighborhood perspective because it's going to impact everyone. And then our ORV program just ended about 2 weeks ago. We're really excited about it, and we've distributed a little under 85,000 vaccines through our ground team and in partnership with the police helicopter. Wells and septic, so ongoing sewage disposal. So approximately 48,000 properties are served by wells. I think sometimes people are surprised by the number in the county, but there's a good deal. And one of the things that I am very proud of is that this team does really great work, but that we don't have a wait list of folks hoping to get some of the permits issued and things coming out. We're able to address these needs for the community in real time. That is a challenge across the state, often based on salaries and not being competitive, and there's a lot going on in this space, but Anne Arundel County is not amongst one of those. So we count ourselves fortunate to have such a wonderful and dedicated workforce, and continuing to support them is crucial to make sure that we don't have any of the issues that we're seeing across the state. And I'll end there and open it up for questions, but I'd also like to thank, because I know a good number of the staff like to watch these, thank all of the health department staff for their hard work. I'm just the person who gets the pleasure of presenting it, but I'm not doing the vast majority of this. And so I have to thank them for everything that they do to keep our communities as safe and healthy as possible.
Questions? Ms. Hummer?
First off, thank you. That was very exhaustive. I mean, that was a lot of information. Y'all are doing some great work in, and you have the data to really target where things go. As I looked at your charts for some of the high areas when we look into health and racial equity outcomes, one of the hot pockets that I don't think is getting some of that outreach that I'd like to work with y'all on to see how we can do is over in Laurel. According to your charts, it has the third highest poverty rate, the second highest low birth weight, and the highest minority population in the county. And we don't really have some of those outreach efforts and things. And so I'd love for us all to put our heads together and find out how we can reach the population over there and really tackle some of those issues. So thank you.
Yeah, absolutely.
Madam Vice Chair?
Thank you, Mr. Chairman. Good morning.
Good morning.
Glasses on, glasses off. I just want to thank everybody for being here, and this is tremendous work. There's a lot of dark blue areas in Glen Burnie, which is always concerning to me, and I appreciate the partnership that we have working in the communities in District 2. I would like to have an opportunity after today to sit down and talk about what we can do with the gun violence that's happening in Glen Burnie. I realize it's different than what's happening in the city of Annapolis. So I don't want to take anything away from what's happening in the city of Annapolis, but while we have tremendous work in the community happening after incident with community outreach and crisis response, and what are we doing to make sure we're trying to prevent it? And I know that's a big, tall order, but I want to. I'd really like to figure out what we can do. It is. I know we're looking at mostly targeted incidents of gun violence, but it does have an effect on the surrounding communities at large, and it's devastating, and it really affects how people feel about their community and their just general safety. So I would like to continue this conversation. It's not something we're going to solve today. And then I look forward to working with you and your team on sorting out the school health nurse issue. So hopefully we can continue collaborating in that budget cycle. I am a little concerned about your vacancy rate, so can you talk a little bit about what you think needs to happen so we can get you staffed to the appropriate level? So what can this council do to support that effort? Thank you.
Yeah, that's a good question. And I think in some respects, the health department is not different than other employers right now who are struggling to fill vacancies. And in other respects, it is specific to healthcare. And so we see, for instance, mental health professionals, many have either left the profession or have gone into a telehealth model only is what they're looking for. So some of it is specific to the role. And then in other areas, I think it's a whole list of things. It could be benefits and salaries. It could be just a shortage in that particular field at the moment. And so I think it is position specific within the department, and some of it is dependent on what you're doing and where it's located and what the hours are. So it would depend on each position, but I think there are things that we can definitely look at.
All right, this is my sort of annual, I guess I'll go to District 6, just to make sure because towards the end of this, I'd like to make and remind the council of its authorities and its powers. And so this will be my annual opportunity, or biannual, by twice a year, that we get to do this. So, thank you. Ms. Rabia.
Thank you. I have a number of questions that are, some of which are just very specific. But one of the things you mentioned was the ongoing disparities in outcomes in maternal health. And it just occurred to me, as a teacher, this is an issue that's, obviously faced in public education and schools as well. And the schools have been able to invest a lot of time and effort in ongoing professional development to, help teachers become more aware of implicit bias and things like that. Is there a window, an avenue for, do, medical professionals have the same sort of requirements of ongoing professional development? Is there an opportunity there? Because I feel like so much, I honestly, before I went through a lot of those trainings, I thought, oh, I'm good, I get this. And I kept finding more and more gaps in, in what I was aware of. And so I'm wondering if, there's a way to bring that into, I know, teachers don't always love it because, you always want to be working on what you actually do in the classroom, but it seems like that could be really valuable.
So yes, more recently in the state of Maryland, and I can speak most confidently about the nursing board and what they require. They do require that you've had some level of continuing education in that area, and attesting to that when you renew your license, whether that's enough, and what institutions as employers should be doing more specifically to keep people up to date. And thinking about that, I know this is one of the things that I've talked to our hospital partners about. They are doing some of this work, and so what are the outcomes of that, and what does it look like in the future? But there are avenues to make sure that medical professionals are getting some of it. Is it enough, and there's not a specific one that we all have to take, right? You get to kind of pick and choose. It's the number of hours or CEU credits that are associated, and so there's opportunity, but I think we also have room for improvement for sure, and growth.
Okay, thank you. Is it okay if I ask a couple more? I have two sort of very specific questions. One was, you mentioned that, again, this is a health disparity regarding asthma emergency department visits in Anne Arundel County, and I'm wondering, do you have any sense of what the cause is? Is there an environmental factor? You might look at, other locations, and there's a very obvious, location or geographic, you're near something, or you're in a city where you have more environmental factors. But is there anything identifiable in Anne Arundel County that's causing those disparities?
I can't say that we've seen any one environmental factor that's causing this particular disparity, because there are kids of other races that are in the same neighborhood with asthma that aren't experiencing the same disparity or ER follow-up. But that is a question that we can look more into and get back to. I think some of it is the disease severity and education and understanding of how to appropriately use the medications, and then management and access to primary care. So whether or not you're actively managing that with a provider and staying kind of up to date on what needs to happen are things that we think are contributing to that. But I'll make sure to get a more specific answer from our asthma-led team, who I have no doubt will give me lots of info. So
may just be a reflection of the same access disparities that we see across the board. Yeah. I still have three more questions, but I'll just ask one more and then let my colleagues go, because I see some red lights here. You mentioned an increase in hospitalizations related to cannabis, and that started even before legalization of recreational cannabis back in July. But I'm curious, what are the conditions that, just I think for an awareness, maybe what kind of conditions are people coming in with related to cannabis that, that maybe folks should be aware of?
Yeah, so it's presentation of cannabis intoxication, right? And so really, are you too high, and what does that look like? And it presents differently in different people. So it may be paranoia and mental health symptoms. It could be that the individual is very groggy and difficult to wake up. We've also seen a lot of nausea and vomiting, depending. So it presents differently in different people, but it ultimately ends up being the diagnosis, and that's how we're able to pull this information, is that they.
So the
Cannabis
symptoms can be all the range of things you mentioned. Okay, thank you. I will leave it at that for now and let someone else take a turn.
Ms. Feet.
Thank you, Mr. Chair. I too have a few questions. Thank you for the very thorough presentation. On slide 27, the violence interruption program slide, the timeline is laid out as far as the steps, but there's not a time frame. So understanding that we are in the planning phase, what on a calendar timeline do you foresee the implementation being?
Sure. So hoping that we receive enough applications this Friday to actually move forward with reviewing the community-based organizations' applications and selecting one by the end of the month, beginning of next month, and then actually putting that out and talking to the community about the organization that was selected, and then moving into hiring. So for me, an absolute best case, and a lot of this depends on hiring and we all know what that market looks like right now. We're looking at maybe early next year to actually have the program up and running. But a lot of that will depend on, do we get appropriate applications? Do people apply appropriately to work these jobs? So it is difficult to put this will happen between this window and this window, because a lot of it is unknown until we actually see applications or start to do the work. But I think at a best case scenario, we're looking at early next year, also taking into consideration the holidays and the training time that they will have to spend with Cure Violence Global, and having enough of the staff on board to implement that and getting it up and running.
Okay. Well, being it's October, the beginning of next year is pretty close. So I appreciate that timeline. If I may, Mr. Chair, I'm glad you touched on the cannabis as a public health topic. The Maryland Association of Counties did a discussion on this at the recent conference, and I found it just fascinating to hear from, especially the pediatric side of public health and cannabis. For those young people who have gone to the hospital or had medical treatment from overdose or use, do we know the form that they are ingesting cannabis? And is it in the home? Is it in the school? As a parent, you talk to your kids, and cannabis is in all forms now. So just out of curiosity, and is there any education being done to reach our youth so that they understand the different forms that cannabis can be in?
For the first part of that question, I'm not sure that we have the deep dive into the medical record on how it was ingested. Did they eat it? Did they smoke it? Don't know that we have that level of information, and whether or not where they took it. So one of the things that we are focusing on is really kind of twofold. There are the children who don't know what they're taking and eat it, and then there are the older children who do know what they're taking that might be in your home. And so how do you lock it up or talk to them, both groups? And so for the second part of your question, I think that's something that we'll have to do more and focus more energy on, is what are the different types and methods of using cannabis? What does it look like? How does it impact you differently? Because one will stay with you longer than the other. One might hit you a little later than the other. And so even having people understand how they work, we often see people who are ingesting it think that they need to take more because they don't feel anything yet. So even understanding when it will hit your bloodstream, you'll get a much faster high if you smoke it. It also wears off faster. So just understanding those differences. And then I think for us also, driving home the health impacts of smoking, no matter what you're smoking, that there are impacts to your lungs regardless. And so making sure that people understand that, both from vaping or if you're smoking in other forms. So we will continue. It's kind of dual for us And I've had that question asked of, well, would you recommend that I eat it? Well, a recommendation, again, there's not a lot of research, so we're not recommending a lot, but it is a question of if people understand the different risks that come along with the various ways to take it and the level of THC in each of those methods. It's different.
Yeah, and if I may ask a follow-up question. So another aspect of this topic that I found quite fascinating as we deal with mental health and the growing number of mental health challenges that we see, obviously from the crisis response slide, you see that those numbers are growing. Cannabis in the medical form prior to legalization was oftentimes used to help treat mental health conditions, but it can also trigger an underlying condition for someone who has not used cannabis in the past. Is there an educational effort to get out into the communities the risks of using cannabis and triggering an underlying mental health condition? Because we certainly don't want to exacerbate what is already happening.
Yeah, I think it's definitely something, talking to people who have a current diagnosis and know, right, are one population. Other individuals who may not have been formally diagnosed and what could potentially happen is really a different population. And so there are some efforts at the state level. We really always decide as a health department what of the state's materials and things can we use and send out, kind of as they are, and then what do we need to tweak or create based on what we're seeing in our community. So I think that's an ongoing need. I can't tell you that there's a robust campaign around it just yet, but I do think we'll continue to. And some of this is even seeing what happens. We are learning from other states. We're not the first state to go through this, so we do kind of know what the data has shown in other places as far as what you see. But we're still really watching it very closely. And so I assume in the future there will be more than one cannabis slide when I come back to present to you all, but
Okay.
We'll see. We're still working on it.
Okay. I have two more areas to touch on, but I'll stand down for right now.
Is there any,
Thank you.
Ms. Robbie?
Just thinking about a lot of the data that you present, it's very, obviously very helpful to understanding, how to target resources. But one of the things I was curious is if in any areas or many areas you break down, you have categories by gender, race, age. Has there been any efforts to break out the LGBT community as a sort of subgroup to look at? I'm thinking particularly mental health, but when you're, talking about violence too, as individuals victims of violence crimes, and I realize that crosses into law enforcement as well. But is that something that there is a breakdown, or could there be a breakdown? Because we've definitely seen a rise nationally of hostility towards the LGBTQ community.
Yeah, so for a number of the data sources that we use, it's not a demographic that's collected, or it's not collected in a way that's uniformed enough across the board. And then there's also questions about when and where people are even comfortable sharing that. So that raises another question. So in many cases, it's not available to us as one of the things that we can disaggregate and better understand. Is it something that would be helpful? Absolutely. But it is something that we struggle with. So in some cases, you'll see it. We're starting to see more around gender, but I still think we've got a good ways to go before we have a robust enough data set to really disaggregate the way that would be helpful.
Thank you, and I definitely understand the difficulties of actually even, getting that data, being able to ask those questions. Okay, my last item is, we always continually hear about the great work of our crisis response teams, and I'm wondering, has there been any expansion, or is there capacity to expand? Is that a possibility? Because it seems like they're very frequently put to, the teams are put to good use, and they're doing great work around the county.
Yeah, so I'll invite Adrienne Michler up to best answer that question.
Thank you, council members, and good morning. Adrienne Meikler, Mental Health Agency. Yes, absolutely, there's always area for expansion. We too face the same challenges you saw with the school nursing staff, though, and we currently are not staffed to our budgeted positions that we have, so that is an ongoing challenge for us as well. The need, as you noted, is increasing. If I could answer a prior question from Councilman Smith, our general growth was approximately 8% a year pre-COVID. With COVID, we saw that dramatic rise, and the numbers never went back down. It's increasing on top of that, and beyond the normal 8% growth.
Ms. Feely?
Thank you. Just one point I have to say, because I always ask a question in this area. I'm just thrilled to see that there's a maternal and infant health task force. I don't think that the general population knows how many cases are out there. So thank you for that. That's huge kudos there. I too want to thank all of the different silos within the Department of Health. You all do an incredible job. I want to definitely recognize the crisis response team. Just looking at these numbers on slide 87, wow. Question on the warm line, since it has more than doubled in call volume since FY20. If you had to do a high-level summary of mostly the warm line, but what you're seeing in these increased numbers, what would that be? Would it be addiction related? Would it be youth and mental health? If just high level, because I know you can't really get into the details, but.
Yeah, I'll invite Adrienne back up as the mental health agency oversees the warm line, so I think she's better suited.
Good morning. Many of the calls are related to mental health, substance misuse, and then some of the social indicators, housing, transportation, those types of needs as well. One of the nice things about our warm line is we do receive over 40,000 calls a year since COVID, and about 80% of those calls are able to be managed through the call center. So that is really impressive. And beyond that, then the teams are just deployed to the various other services. I think those, again, straight mental health, substance misuse, and then housing and transportation are the other categories.
Great, thank you.
Thank you all for coming down here today, your entire department. My shameless a couple PSAs, school nurses. I'm definitely looking forward to being able to assist them with their long-term stability when it comes to the county, because I do believe they're an important asset to the school system, and quite frankly, they should be merit. But that's my own 2 cents. Shout out to AA Power. I've done some research on that organization and what they do, because obviously addiction services and helping that vulnerable population is very important. And so that group, I know, has been kind of going out there in the communities, in the woods, behind dumpsters, and you name it. It sounds like they literally do have superpowers, AA Power, hence. So kudos to that group, and hopefully they can continue to receive the support to sustain their operations. Looking forward to working with you on the Brooklyn Park, like the RATS program, whatever we do to minimize rodent control up there, because it is certainly a big nuisance for those families up there. And that leads me to our charter, our code that states, in addition to our powers, like this county Board of Health has the ability, may adopt and enforce rules and regulations on any nuisance or cause of disease in this county. And so I'm just spelling it out. That's a shameless plug, because we have that ability. And whenever we decide to leverage those authorities, that certainly is on us, but we have those authorities, and at least in my mind. And then the health officer for a county is the executive officer and secretary of the county Board of Health. And so I just want us to get used to hearing that, because I think when you hear it enough, you're like, oh, wow, that is my responsibility. I should do more about it. And so as the Board of Health, I think we have a lot of authority that we don't necessarily leverage, but who's to say that in the future we shouldn't. But totally understand the health department and its construct, and you do a great job, and your team do a great job of leading that effort, but I'm just focused on this institution and making sure they're aware of those authorities. Outside of that, I see no more lights. Is there any other comments you may have for this body as we close out? Okay, seeing no lights from the county council members, is there any other business to be brought before the Board of Health? Seeing none, may I have a motion to adjourn as the Board of Health?
Motion to adjourn.
Is there a second? Second. All right, all in favor?
Aye.
The motion carries. Any opposed? I'm sorry. Hearing none, the motion carries. The Anne Arundel County Board of Health is adjourned until next May. All right?
Thank you.
Do you guys need a 2-second, 3-second break? Okay, we'll take a 5-minute break and then a recess, and then we will adjourn back in this chambers as the county council. I've been wanting to eat this.
I'm gonna try and limit myself to half a donut, a half donut. Yeah, welcome to life.
Well, it's kind of just like when well, and you know, you deal with people unfortunately. Yes, I do. It is the thought, even when if I'm being annoyed, the thought of having to start over because it's been almost 30 years and I still haven't gotten trained the way I wanted, and I'm too old to do that again, so I just gotta live with it.
I will tell you not to do it. That's your business. That's not my business. But what are we doing? Does this make sense for you?
It's kind of just move apart from each other.
I look at the Warren Buffett thing, yeah. Like, he and his wife stayed married forever. They did not live together. They have separate lives. You have a partner, you don't.
But it's kind of, it's just, I mean, yeah, I think about how, but I mean, I have to say, the past couple of days I've been ready to, I actually told him last night, I said, we've been 20 however many years, and I can't believe he comes downstairs and he says, oh, I booked a flight, I'm going to see my mother, and I says, were you gonna tell me ahead of time? I said, where are you going? Did you even look at the calendar to see? And he was like,
The longer that you're together, the weirder things. I've heard some weird things. That's all I'll say.
I never heard you going to visit your mother, but
Right,
would
she's
you
talking
run
about
the dates by me ahead of me? I was like, holy cow. He just looked at me like, what do you mean? Oh my gosh. You know? It's nice, but
My 10-year was last week. Yeah, exactly.
He's like, I know I'm annoying, so I gotta do something. I gotta show her. You know, I gotta put on a show.
Are you getting stoned down? Or just getting
Is it intentional? Yeah.
Everybody at once.
Yep.
By the time, so when we did one before, it was 3 nights, 4 days, and I was ready to stay longer. But this one was 4 nights, 5 days, and I was ready to stay.
The October 10th, 2023 work session of Anne Arundel County Council is called to order. Please ensure all electronic devices remain in silent mode. May I have a motion that the partial reading of any bill, resolution, amendment to a bill or resolution, or minutes constitutes the reading of the whole?
So moved, Allison Pickard.
Is there a second?
Rabbian, second.
All in favor? Aye. Any opposed? Motion carries. Madam Secretary, please read the title of the resolutions to be introduced this morning.
Resolution number 4623, resolution approving a conditional appropriation of coronavirus state and local fiscal recovery funds in excess of $500,000 to the Grant Special Revenue Fund.
The public hearing on Resolution 4623 will be held during the regular meeting on October 16th, 2023. All right, at this time, we will start and open up discussion on Bill number 7523, ordinance 7523. And Mr. Hunt.
Thank you, Mr. Chairman. At the table with me are Chris Daniels from the Office of Central Services and Christine Nieder from the Office of Law. Bill 7523 is the approval of a lease between Anne Arundel County and Gaudenzia Incorporated. This is another one of those entities that is located on the Crownsville Hospital Complex, and we acquired it in December of 2022. Gaudenzia leased 105 and 107 Circle Drive in Crownsville from the state. The two buildings are approximately 52,000 square feet. They've been there since 2016, and after being leased the property in 2014, Gaudenzia spent approximately $2.6 million of their own money to renovate the leased property. The tenant has 175 licensed residential bed behavioral health facility, and it specializes in substance use and mental health treatment. In fiscal year 23, Gaudenzia provided services to 3,200 clients. There are 81 employees on site, 24 hours. Both the county and Gaudenzia desire to enter into a lease that would be 35 years plus two 30-year renewal options for $1 per year. Tenant will be responsible for all utilities and serve the leased premises as well as all maintenance and repairs to the buildings and property. We're happy to answer any questions you have.
Thank you. Any additional comments from council members? Obviously, we've heard and talked about this bill previously. All right, seeing none, thank you for coming down. We'll now next transition over to Bill number 7623. And Mr. Hunt?
It's mine.
Oh, is it yours? I'm sorry.
It's okay.
All right, Mr. Vokey?
Thank you, Mr. Chair. 7623 is keeping with my theme of common sense at times, trying to find places where we can do that in the code. So a few years ago, some of you will recall, we increased the size of sheds that could be placed on residential property without a permit up to 150 square feet. That was an increase from 64 square feet. In doing so, we increased the ability of folks to add improvements to their property without having to come to the county and use county resources, because we said that isn't necessarily a good use of county resources on that. We think that's okay. But what we did not do was change the corresponding square footage for accessory structures such as pergolas, pavilions, or gazebos. So for any of those, regardless of size, you still need to come to the county. You still need to get a permit. So what I did is reached out to inspections and permits and asked them for their feedback. And Mr. McCara and Mr. Wiedemeyer were very kind, and they worked with me, and we were able to find a solution that I think appropriately balances their concerns about size and building without regulation or sort of oversight, but also gives flexibility to property owners. So that's one piece of this bill. The other piece is the decks that are what are known as freestanding decks. So they're under 200 square feet, less than 30 inches off the ground. I believe it's less than 30 inches off the ground. Those decks are just less subject to sort of the heave and the frost heave is what it's called, when you have footings and you need to be able to dig down and put in a deck. So as long as those decks are freestanding, this would exempt them from any need for a permit, whereas currently they are required to get a permit. That is actually something that is in the International Residential Code, I believe, the IRC, in Section 1. But what we do in Anne Arundel County is rewrite the entirety of Section 1. Hence, we have our own rules there. So we are adapting some of the provisions that exist in the model IRC to bring them into Anne Arundel County. So I appreciate the work with IMP. I appreciate their feedback and help on this bill, and I'm hopeful that this is going to be a pretty simple and straightforward update to the code that gives some acceptable leeway to property owners to make improvements on their own properties. So thank you.
Mr. Hunt?
Thank you, Mr. Chair. Andrew McCara here from IMP, as well as Lynn Miller from OPZ and Lori Blair Klossmeyer from the Office of Law. The sponsor did work with INP over the last couple of months developing the language in this bill, and we're comfortable with it.
Any additional, Ms. Rabia?
I just want to ask how this might impact the enforcement of the critical area. I think there's still a lot of folks that don't even realize that they may have requirements with respect to the critical area. And so I'm just curious, is that a place, in the permitting process, is that a place where you would sort of be able to flag issues?
Andrew McCara, Inspection and Permits. So what we are doing with this bill is adding in that if these structures are on a waterfront property, they do need to have a permit. Of course, that's not the entirety of the critical area. We thought it was just clearer language for a homeowner to know, oh, I'm on waterfront, I need to get a permit. Speaking with planning and zoning, but Lynn Miller's here to speak more if needed. That's where most of the violations are found, on the waterfront properties. And just to clarify, again, just because you don't need to get a permit doesn't mean you don't need to follow all the rules, including building and zoning rules. So, this is not just letting people do what they want in the critical area.
Right. And I guess I'm just curious, how much that process is used to make sure that people are following the rules. And obviously, especially with respect to the critical area.
Hi, Lynn Miller, Planning and Zoning. So in the critical area, RCA and LDA, lot coverage limitations do include these types of accessory structures. So Mr. McCarr is correct that by accepting waterfront properties, that will cover a lot of them. If the concern is that there are other properties in the critical area that would be avoiding permitting and therefore might have coverage issues, I guess you could consider, instead of accepting waterfront property, you could consider accepting properties within the critical area, LDA and RCA. And that might be another alternative to consider.
Okay, thank you. I guess I'll think about that.
Any additional comments? All right, thank you all for your testimony. The next piece of legislation we will look at is Bill 7723. Mr. Volke, I think that's yours as well.
It is. Thank you, Mr. Chair. So this is basically dealing with a very, very specific type of circumstance, if you will. It effectively says that if you meet all these criteria, then for a wood recycling facility, you are able to operate in a different zone than what you would normally be allowed to operate in. So I guess that's kind of the high level way of putting it, and I will leave it at the high level because I'm sure that there will be some comments from OPZ drilling down on any concerns that they may have. Thank you.
Thank you, Mr. Chairman. The administration does have some concerns with this bill. It would, one concern is that it would circumvent the intent of the special exception process, special exception use requirements, as well as the procedures and public process for approval, and would allow expansion of what is currently a special exception use without the approval of the administrative officer, which is not consistent with the requirements for other special exception uses. And it would also eliminate many of the special exception requirements for a natural wood waste recycling facility that are in place with the intent of minimizing adverse impacts on surrounding properties. That's the quick list, but we have Lynn Miller from OPZ here and Lori Blair Klossmeyer from the Office of Law to answer more detailed questions.
Mr. Chair.
Yep, please.
Thank you. Ms. Miller, quick question. How many properties do you anticipate that this bill would impact in the county?
To our knowledge, it would affect one specific business.
Madam Vice Chair.
Thank you, Mr. Chairman. This is a question for this, well, it's a question for everyone. When you say it affects one property, that means it would allow, the way the bill is drafted, it would allow one property, but there are surrounding properties in that area, I would assume, that would now be dealing with a use that is not necessarily permitted by right. Correct?
Yeah, that's correct. So as Mr. Hunt stated, one large concern we would have with this would be its potential to set precedent. I mean, there's close to 70, I think, special exception uses in the code, and the special exception provisions are there specifically for these types of uses to prevent detrimental impacts to public health, safety, and welfare, nuisances to surrounding properties. So, our concern is by accepting this one particular business from not only the special exception requirements or the special exception process, but it also would relieve it from the majority of the special exception requirements that apply to this type of use, to a natural wood waste recycling facility. And those are the requirements that are put in place to help minimize impacts to surrounding properties.
Thank you, Mr. Chair.
Please.
I just bring it up because we have areas in my community, specifically in the Queenstown area, that have been really devastatedly affected by, long ago upzoning to industrial when really the community is residential, and they're now that the properties have sold and are having an industrial use, it's been, by right, unfortunately, it's been really detrimental to that community. So without going through a special exception in this situation, you're not allowing the community to be engaged in any sort of input or hearing, it's my understanding. So I don't know if the sponsor is open to a special exception process for this situation, or it's just something to think about. Thank you.
Any to see no additional lights? All right. We will now transition to bill number 7823.
Thank you for your patience while I got the tech ready.
Nope, Mr. Barron, over to you.
All right. I am going to try. But of course, my computer is being my computer. Yep. There we go. All right. So thank you, council members. Excited to bring forward 7823. for today's work session discussion. This bill has been a long time coming. It is a major priority of the county executive. We have a lot to go through, so I'm going to go through a very brief presentation, high level, and then we look forward to the discussion on the specifics of this bill. So I'm going to talk a little bit about, well, actually, I'm going to let Aaron Karpowitz from our community development ACDS take over and talk a little bit about the housing crisis and the needs in the county to sort of set the table about where this bill comes from. And I don't think you're going to be.
Yeah. Hi, good morning, council members. Erin Karpowitz from ACDS. I just want to thank you for having me here this morning. As many of you know, housing is inaffordability is a huge issue in the county. We commissioned a study back in 2019 to look at the housing needs in the county, and then we had that updated for the rental needs in 2020 at the end of 2022. And we've seen between those two studies that rental prices have risen dramatically, increasing about 5.7% each year, and that compounds, so that a rental unit, a typical rental unit that rented for $1,566 in 2019 rented for almost $1,900 at the end of 2022. And we see this play out every day in our programs that we administer and that our partners throughout the county administer, just with people coming in to, they may have a voucher. We run a program where they have housing vouchers for people who are getting back to work and are trying to be self-sufficient, and we give them rental assistance, but they cannot find a unit that they can rent at the fair market rent, which is the HUD level. So it's really difficult, and it's especially difficult for them to find those units in areas outside of our older communities. Usually those are the affordable housing units are concentrated in certain communities. Next slide. We know that we're over 12,000 units short for renters who are making low and moderate incomes in the county. We also know that out of 45%, that 45% of all renters in the county, regardless of their income, are cost burdened. And 19% of all renters are severely cost burdened. That means they're paying more than 50% of their incomes for housing. Next slide. And then, we know from our friends at the Housing Commission of Anne Arundel County, they have over 31,000 households on their waiting list for the various programs that they provide, which is astounding. And finally, we know too that on the homeownership front, from 2017 to 2022, median home prices have way outpaced the increase in median household income. So the median home prices increased by 35%. It's at the end of 2022, it was about $438,000 for the median sales price at the end of the year. Meanwhile, incomes rose just 17.3%. And we know that too, it plays out. We run a homeownership counseling program. We have about 375 active participants in that program, and it's very difficult for them to find homes that they can afford to buy in the county.
So thank you, Aaron. I want to talk a little bit about the progress that we have made in this county. It's over the last 5 years, going on almost 6 years now, the county executive and this body have tackled some major housing issues. We passed fair housing legislation. We passed workforce housing zoning improvements. We've passed pilots for affordable housing. We created an affordable housing trust fund and funded it. Councilwoman Rodvian passed a 7-0 accessory dwelling unit bill. We have school adequate facilities reform, which passed 7-0 as well. 7823 is another tool to tackle housing affordability. It is not the only tool, and it is not the only one that we still have work left to do on. The county executive has been working in collaboration with stakeholders on redevelopment legislation, and I know several council members are looking at other changes that need to be tackled to increase access to housing in this county. And then, of course, as you all know, we have our region plans and our comp zoning coming in the near future. So this is one additional tool to tackle affordability. So how did we develop this bill? We gathered a large group of stakeholders, county staff, advocates, members from the development community. We met several times over the course of 2019 and early 2020. I think in my notes, March 10th, 2020 was the last meeting we held. Something happened about a week later that's interrupted the work. And then we've had other priorities, other bills. And so about late spring, early summer, we picked up our notes from that effort, dusted off the draft and sent it around to a large group of stakeholders, including all 7 of you. I want to thank you all for feedback we got. We took the feedback from the housing advocates, from the development community to heart, and made a number of changes to the draft that was circulated in the beginning of August. And then the proposal before you incorporates those suggestions, and look forward to discussing it more. So what is Essential Worker Housing Access Act? It is often called a moderately priced dwelling unit or an inclusionary zoning law. How does it work? A percentage of new development is set aside for essential worker housing, and then those units are sold or rented to qualified residents. There's a graphic here on the side because we're talking about units, but we're also talking about families here. So wanted to sort of illustrate this this is an apartment building. So 15% would be set aside for families. That in this example, it's 9. And so we're not talking about 9 people or 9 units. We're talking about 9 families, which could be an individual, and I think that's a dog, and whole families. So just to drive home, we're talking about units, but as you all know, in a unit, in a rental unit or a house, it could be a single person, it could be a large family. This is a proven program. Inclusionary zoning, moderately priced dwelling unit laws exist in over 700 jurisdictions around the country, including several of our neighbors here in Maryland. They look a little different in every iteration. Part of the work that we did was look at programs that worked well and programs that didn't work well, and put forward a proposal before you that we think incorporates the best of those programs around the country. So let's talk a little bit about the key provisions of the bill. When a new development comes forward, the first question is, how big is it? If it's 1 to 9 units, whether it's multifamily or home ownership, it will be exempt from the law. And that's a recognition that it just would not work on a small development scale. For 10 to 19 units, we require moderately priced dwelling units, we require the housing, but we provide an option for fee in lieu, which recognizes that sometimes those smaller developments need be hard to create an MPDU. So there's some escape valves in the law to allow for a fee in lieu option. And then 20 plus units, the developer must provide the moderately priced dwelling unit. This does not apply to housing authority finance developments, so LIHTC projects or a HUD funded program, or workforce housing or housing for the elderly of moderate means. They're already providing affordable housing, so we would not put a requirement that you create thing you're already creating. So then how many MPDUs are required? In a home ownership development, it will be 10% of the development under the proposal. In the rental market, it is 15% of the development. Well, how do we make sure that there's somebody ready to take the property? ACDS will qualify applicants, and Aaron mentioned they already are experienced in their home ownership and a number of other programs where they work with buyers and renters to get them ready. They will qualify them, and then that qualification, you need to do certain things, right? So one of the requirements is that you have to be a county resident for at least a year, or you have to be employed by the city of Annapolis or the county or the public school system for a year. You can't have an income for a rental above 75% AMI. So you have to be 75% AMI or below. For home ownership, you have to be 100% AMI or below. And we use the example of $88,000 for a family of four is 75% AMI. $118,000 for a family of four is 100% AMI. Those we can break those numbers down further based on size, because family size matters in what your threshold is. And then those thresholds can be adjusted twice a year under this proposal. That was a specific request from the development community, and we agreed that the market and situations change, so we'll be able to adjust those numbers on a biannual basis. So similar to workforce housing and elderly and moderate means, this proposal provides some incentives to the development community. So one of the pieces of feedback that we heard from the development community was there's cost to this, and the county executive met with the development community. We got some good feedback. We heard from all of you about concerns about making sure this would work. And then we looked at some bills around the country that do provide incentives and how they're able to work. So what this bill does, just like workforce and elderly of moderate means, it provides a significant cost savings to the developer. That's impact fees are waived for the MPDUs in that development, and a 50% reduction in capital facility connection charges. If there are no eligible buyers, which is another concern, you don't want to have a unit just sitting on someone's books forever. If there is no eligible buyer, ACDS and the Housing Authority have the right of first refusal to purchase it. If they decline to take that unit can then be sold to non-eligible buyers, folks over income, but it would be subject to the MPDU deed restrictions. So, for example, it's a rental unit, you would have to rent it at that lower price. I'm sorry, yes, you would have to, I confused myself. Let me back that out. For home ownership, you would be able to sell it. The buyer would not have to be qualified. I'll clarify that. A modest density bonus is provided, and the law is effective July 1st, 2024, to allow some additional time for the market to adjust and the county to gear up for the program. There are other provisions in this bill that I didn't touch on. The control period, how long the piece of property is held as an MPDU unit, and other provisions, and we're happy to answer any questions, but wanted to give you a brief overview in this work session. So that's our presentation for today, and we're happy to answer any questions. Last thing, Mr. Chair, sorry, I did not introduce the folks at the table. Please. I was super excited to get get going. We have our Deputy CAO for Land Use, Jansen Evelyn, to my left. You already heard from Aaron Karpowitz from ACDS. We have Lynn Miller and Michael Stringer from OPZ, and Lori Blair Klausmeyer from the Office of Law. So with that, I'm going to turn off my computer and happy to answer any questions.
I'm sure you're going to have several today. This is an important bill. I think all of us collectively have stated, on the record or otherwise, how important it is for housing for our community. I mentioned this to you previously about making sure we actually put something in place that works and not just pass a bill that sounds good on paper, but when it comes to the actual realization of housing, it doesn't produce anything. So I'm excited to sort of navigate through this to see exactly how. I did have a couple of questions. One of those was on the 20, and this just kind of popped off my head, the 20 and greater. If somebody had 20 units that they were building for PDU, would they have to do one or two? Because 15% for, if they were doing apartments, would that mean that they would have to, where's that line? Because I know you're going to have that in some instances where the threshold is.
Yeah, and so we talked about that. You round up, but there's language in the bill, and I want to point directly to the language. Page 7, fractional, line 15, thank you, Councilman Ryan. Line 15, fractional units.
Right. All right. And I'm saying these because I want people to hear it, because a lot of times residents, they may not, or folks who are impacted by this may not read the actual bill. And so some of those things I want to call out. But how does the essential workforce demographics compare to the workforce housing demographic? Is that something you all studied over this time period?
Yeah, so we looked at it carefully, and there was a lot of discussion about what those income thresholds should be. And I'm going to ask Aaron to give you the specifics because I always get them confused. But there's some similarity, but there is a difference.
Mm-hmm. So for the home ownership income thresholds, it's actually the same as the workforce housing. So it would be households at 100% of AMI, and that was that number that Pete quoted for a household size of 4 is about 118,000. For the rental, the threshold for this bill is slightly higher than the workforce housing zoning provision. Workforce housing is at 60% of area median income, and for this one it's 75%. So just to give you an indication of the numbers on that, for 60% of area median income, for a household size of 3, or I'm sorry, let's stick with 4 to be consistent. That's about 73,000 a year for the full household. And then the 75%, which would fall under this one, is 88,700. And the reason, again, there was a lot of discussion about that, and one thought was, we want to make sure that we capture, first year teachers and
I guess we'll pause for a second.
Well, that was interesting.
I guess the administration has already started building houses. Haven't even passed the bill yet.
Yeah. But just to finish that thought, we wanted to make sure that the income eligibility threshold allowed for first-time teachers and other folks at that threshold, but they, people at the lower thresholds would be able to also qualify for those rental units.
Right. And so to just drive that point home, this is sort of trying to hit that moderate income price point.
So as you target, what are those targeted goals? So your goal is to for rental and home ownership. What you obviously want to. Is there a target that you're striving for when it comes to this group of folks?
I'm sorry, can you repeat the question?
Are there objectives as we deep dive into the population that we're trying to impact, or do you have targeted goals for rental and home ownership when it comes to this specific program?
So this is a market solution, right? So this will, the production of units will be based on how much is produced in new development, right? So there are other programs that Aaron runs and that the Housing Commission runs that also are targeting populations and building and creating units. So to the question about what we're trying to capture is, as Aaron mentioned, we tried to make sure that the market thresholds, or the thresholds on the rules of this bill, would capture teachers and firefighters and healthcare workers and service sector employees. So that's why we set those targets at that level.
Okay. I guess I'll switch over to Madam Vice Chair.
Thank you, Mr. Chairman. I do have about 20 questions, but I wanted to start this conversation with a more global question. We have, at the federal level and at states across the country, legislation being passed to boost housing production in localities and tackle affordability in different ways that all impose mandates and things and incentives and onto local jurisdictions. I'm curious, with the affordability issue that's facing really the country, not just Anne Arundel County. We are not unique in this crisis. At this moment in time, with permits at a 40% decline year over year, we're not really building housing like we have in other decades in Anne Arundel County. So I'm curious, with pending preemption on the looming and things like that, why the administration chose at this time to bring in a policy that is more subsidizing demand rather than looking to boost construction. I'm concerned that this housing policy, while it has worked in other jurisdictions that are different from Anne Arundel County, and they adopted it decades ago, why you think this time, 2023, the housing market, the construction market is the time to impose further regulation on construction rather than looking truly to one of our biggest barriers, and it's the zoning code that needs reform.
So I'll try to answer that, Councilwoman. Thank you for the question. I think it's an important balancing act. I think that's why in this bill you see that there is incentives in the legislation of, several tens of thousands of dollars to the development community for each unit in fee reduction. But this bill does not stand alone in the work that this county is undertaking. In addition to the coming comprehensive zoning work that's on the near-term horizon, we have a redevelopment bill that is being prepared and is, the county exec intends to introduce that in the near term. That will help incentivize and create flexibility to reuse parcels and get additional housing development out of underused and already developed parcels. And then we've also, the budget that this council just passed, funded and created a long-term revenue stream for the Affordable Housing Trust Fund. So I think it is an all of the above approach, and this is a very attractive place to, if you are looking in the area, to come and raise a family, and we have great schools, we have great natural resources, we have job centers. There is still demand, and while you reference a current regional decline in permits, in building permits over the past couple of years, there is still building happening in this county at quite the clip. I mean, you drove right past several hundred units of now luxury apartments on your way down 97 and 50 if you came into this town. That development, had it included a moderately priced dwelling unit requirement, could have been housing for 50 or 60 families. So I think it's a fair question. It's one we took seriously about ensuring that this was not just a totally unfunded mandate on the development community. The draft that we had initially circulated, it did not include some of those incentives and fee reductions, and that came directly from feedback from the industry and from experts in creating additional housing capacity.
Thank you, Mr. Chair, Mr. Barron. I do think my colleagues and I have a lot of questions. This is a very big bill to undertake. You didn't, though, articulate the need for very serious zoning reform in this county. And while you say it's coming, you've chosen a different tact at this moment in time. We're not going to see multifamily in the inclusionary nature that this bill on paper says we're going to see, because we don't have land zoned throughout the county in such a way that will bring it forth. But we have a lot of questions to get to, so I'm going to turn it over to my colleagues.
Can I just respond a little bit to that, Mr. Chair? I mean, I did mention that we do have zoning coming. I did mention some of the and I didn't mention it by name, but Plan 2040 does have some stuff. And you did send a very astute question on some of the holding capacity work that has been done in advance of this, which is why Michael Stringer is sitting at the table. So if you want, we can provide a little bit more information on that, because yes, this county does have less land than it did yesterday, and it'll have even less land tomorrow for development, but there is still development occurring in this county. And so it would be I think the county executive views it would be a missed opportunity to not include an inclusionary piece of this. None of that excludes missing middle work coming down the pike.
I'm going to go to Mr. Volke.
Thank you, Mr. Chair. I hope this is an easy question. If ACDS makes a decision, is that decision under the charter appealable? Because ACDS is not necessarily a county agency, but is a contractor with the county. How does that work in terms of the charter and the interplay and the appealability of an ACDS decision?
We have Office of Law here, but can you help by being a little bit more specific at what type of decision?
Sure. So I think ACDS is making some decisions in this bill, right? Hang on, I'm getting there. They're going to make decisions about the number of units required, eligible households.
That's not ACDS. That's
Okay.
OPZ makes the eligibility or the number of units.
So just to be clear, all the decisions then are going to be OPZ decisions, and so they'll be appealable as OPZ. They won't be ACDS decisions.
We were just whispering about this. I think there are, and we can turn it over to Lori Blair Klausmeyer, because she does have her light on. What we came up with on this side of the table was the eligibility thresholds, but that's articulated how they create those in the bill.
Okay.
Right? It's a certain percentage of AMI that's published not by an independent body. So maybe I'll let Lori add some thoughts.
Thank you.
Well, the only thing I was going to add, I'm sorry, Lori Blair Klausmeyer, Deputy County Attorney, was that this bill specifically makes any decisions of the administrator or the planning and zoning officer subject to appeal to the Board of Appeals. So does that answer the question, or is
It does, as long as there's an agreement at the table that all the decisions are going to be made by OPZ. But I think this program is being administered by ACDS, is what I thought. So if that's the case, then ACDS would be the administrator. So that's where we need some clarification to understand who's the administrator.
okay?
If my question's not making sense, you can tell me that.
So I guess my question about your question
Yeah,
is: Are
please.
you asking whether there's authority to make the decisions of the administrator appealable? Is that the question?
Kind of. I guess it's more, if all the decisions are being made by OPZ, then we have a very clear way that we know how to appeal those decisions. Goes up, it's always done that way. If ACDS is making decisions, then under the charter, are you allowed to appeal an ACDS decision? Or are we saying that under this bill, ACDS is not making decisions and it is all OPZ?
Mr. Volke, and I think you referenced this is page 14, line 12. It says those decisions are appealable.
Person aggrieved by the final decision of the administrator or the planning and zoning officer may appeal. So it seems like the administrator and the planning and zoning officer are different, but so this would allow ACD, and this is not a problem with the charter, that you can appeal a decision of a non-county agency, if you will. Because ACDS being a contractor with the county, that's not a
Right,
charter
but acting
issue.
on behalf of the county under the statutory authority granted
Okay.
by this bill.
And so there's no charter issue with that appeal.
I don't think so.
Okay, cool. Thank you.
Ms. Hummer?
Yes, so this is going back to some of the, how many units, how many things are coming online with the system. I have heard that when we talk about what kind of production, how many units we're going to see from this, I've heard multiple numbers thrown out ranging from 70 to 220, and that's a big gap. I believe that this has been requested, but I want to say again that I would like to see some data on new subdivisions that have been approved for the last 2 to 5 years, so we can see what the record has been on units, and so we can really get a good prediction of what we think this could yield.
Yeah, thank you for asking the question, because I think it's an important one, and it's one we've been working on. In fact, the 220 number comes from us, and I think it might be a little bit high because incorporated in this bill are several exceptions for elderly of moderate means and workforce housing. So OPZ is doing the work right now to redo that. We will provide the full council with a full breakdown, not only of the number of units by project size over the past 5 years, but project type. So multifamily and townhome and single family, so that we can see, what types of units are created. But I do want to flag that's the past is an indicator of the future, but we only have backward-looking data, right? We can't say that tomorrow the owner of a 50-acre parcel is going to put in a site development plan for, it's zoned R5 or whatever, right? 250 townhomes or something like that.
Certainly, but we'll get an idea of the trend and where
We would get trends, and we are refining that data now, and we'll send it to you.
When do you think,
I think it'll be this week.
Okay,
Yeah.
thank you.
Ms. Rodney?
Before the hearing.
Thank you. I want to start with just a nuts and bolts question. And this is the choice of using the Baltimore Metro statistical area. If I'm correct, there isn't a separate one for Anne Arundel County. Is that correct?
Yeah, that's correct. You often see different, the household median income for Anne Arundel County, and it's one number. It's not broken down by household size. So that's a great data point to demonstrate, factually what the income is for here. But when we're talking about eligibility for programs and beneficiaries, we need to break it down by household size to get a true measure of what the affordability is. And so HUD actually breaks down area median income by the Baltimore Metropolitan Statistical Area, and so we take that number, and they don't necessarily calculate every single threshold. So, for example, 75% and 100% are not numbers that are calculated by HUD, but we're able to take the numbers that they adjust for 80% of AMI by household size, and we do a consistent calculation on that every year to qualify people for our programs that are set at our 100%.
Okay, and I think I got the answer I was looking for. I was actually looking for the geographic choice of why Baltimore, and that's because there isn't an option for Anne Arundel, right?
Correct,
Okay.
yeah. So Anne Arundel is within the Baltimore metro area, and that's the only way to get the numbers calculated.
Okay, thank you. Is it okay if I ask one or two more? Okay. I'm curious, so there's information in the bill, or there's language in the bill about how what sort of the allowable cap is for the rental rates and for the sales rate. But I'm curious, how exactly is that calculated? And is it safe to assume that developers are going to go straight to the max allowable, or does it have to be calculated on the income of the actual applicant?
Yeah, so on the home ownership, we found in our experience, especially we were the administrators for a short time for the city of Annapolis's MPDU program because they were short-staffed. And so it's really hard sometimes if you set, and yes, I think we can assume that the developers are going to go to the maximum amount that they're allowed to under the law to set the price. So in order to find an appropriate band of households that are earning that income, we created a wider band. So you calculate the affordability at 80%, but you can qualify households going up to 100% of AMI. And that's so that you have enough households. On the renter side, it's easier to find renters and that qualify. So that one is set at the 75%.
So it would be the band of individuals who are in percentages higher than that threshold.
So the affordability threshold is set at 80%, so the house price is affordable to a household making 80%, and then the band of individuals would theoretically be individuals that are earning between 80% and 100% of AMI. And I mean, if a household earning less than 80% can qualify for a first mortgage and afford the house, everybody's individual circumstance is different. They could also get into that house as long as their income is under the 100%.
But the developer wouldn't be required to drop the rental rate or the market price for the house down to meet that individual. Say if the level were 80% and the individual applicant only made 75% of AMI,
correct,
the price doesn't change.
You're correct.
Okay.
Yes.
And actually related to that, as I've been looking at this, I'm curious if the administration looked at creating more than one band, just to, if you can see that you're going to capture different groups of individuals, and obviously you're going to capture different groups of individuals at 75, and so you'd be 75 to 100, for example. Was there any discussion of saying, hey, we ought to have a band that also includes 50 to 75 or 60 to 75 or anything like that?
So there were lots of discussions about what the right level to set it at is. There's also concern about creating a program that is so complex, it's challenging to administer. So those lower bands of income are also tackled through programs in the housing trust fund, through LIHTC, through workforce housing, which has a lower on the rental side, a lower threshold. So it was, I think, if we had infinite resources and were able to create a more complicated program, we would. But the decision was, at some point, you have to just say, what is the best program that will still be workable. I mean, the developers are still going to have to live under this law, so we don't want something that is so complicated that it just doesn't work, as well as Erin and her team are going to have to administer it. So making sure we sort of do the most good.
Okay, and if it's all right, if I could ask just one last, I have more, but I just one that's sort of all on the same topic. So, of course, one of the groups that comes to mind, as a teacher is teachers, and so setting the 75% of AMI for a household of one, in my calculation, puts it in the low 60s, and so and would be I would just want to make sure I understand that would be the price, not necessarily the individuals eligible. The individuals eligible could go above 75% for a household of one?
No.
You go for it. No, not for rental.
Yeah.
Okay, so not for.
Yeah, for rental, the developer or owner of the rental property would have to set the rent limit at a price that's affordable to a household earning 75%. So I don't actually have that calculation quite yet. But for example, I can tell you for a one bedroom, if you set it at 70%, so it would be slightly above, it would be roughly $1,600. That would be the rent, and that would be the advertised rent for that property. Then when we qualify households, they could also not exceed that $62,000 income limit. So you could have a teacher who's a first-year teacher who's making $58,000, and they could get into that one-bedroom unit. Or you could have someone, let's say, that's making $50,000 and they're at a lower income, they could get in. But if you had someone who's making $65,000, they would not be able to qualify for that rental unit. It works a little bit differently on the homeownership side, as I was explaining before.
I guess I just raised that as a concern, is that particular threshold, just the way that it matches. And it's great that that the county is actually has moved teacher salaries up. So we're closer to hitting that band, but I'm also concerned that a lot of folks that would be in need of the MPDU type, housing are going to be locked out of eligibility because of where that threshold is set. And that's where the thought of, multiple tiers, obviously I can understand the administrative difficulty of having more than one tier, but, that is a big population that I personally am aware of that has a difficult time finding affordable housing in the county.
So the one just on that point, is because we looked at it, remember that these numbers will change up to twice a year, so that we'll be looking at it. So as numbers change and hopefully we're still going to be raising teacher salaries too. Blueprint does have some requirements for first-year teachers. So, I mean, there is a stepping up that happens through the twice annual review of that. And Aaron reminded me that if there is not an eligible person, the administrator can raise the income limits a little bit.
Based on, the data that was presented to us, I can't imagine there would possibly be a shortage of applicants. It seems like these are going to go like hotcakes. And so my worry is that we put teachers in a position where they have housing that, that sort of matches with their salary for maybe 1 year or maybe 2 years. I'd have to look at and again, I'm focusing on one category that I just happen to be very familiar with, but then after 1 or 2 years, they would be, they would not be eligible.
Well, yes.
Assuming things grow proportionally, and of course there's a lot of factors in how things will grow, but assuming the AMI grows proportionally with salary scales.
But one thing to focus here, we don't kick people out. So if you get in, you are qualified. You
don't have to re-qualify annually?
No.
So
Yes. Every 3 years.
Well, yeah. Go ahead.
Yeah.
Correct.
So we would be monitoring the units and doing a monitoring review of income eligibility, but there is a grandfathering clause that if somebody's income goes up, they're allowed to reside in that unit for a certain number of years. I need to find exactly where that is.
Okay, I think I understand everything, and maybe just have a little disagreement with the level there. So that might be something I bring an amendment to discuss. But I will let it go and let my colleagues ask questions.
can you go? I want to go to Ms. Ledbetter. She was next in the queue. Sorry.
Just to be clear, since I had a slight misstatement, it's page 12, bottom of the page 12, line 40, review of rental rates. There is a section on that. Just to be clear.
Mr. Chairman, if I might.
Go ahead. Is it in reference to this?
Yes.
Okay, go ahead.
Before we leave this topic, it's my understanding, and I'm looking for it on page 12, if we are allowing a person who's become income ineligible to remain in that MPDU unit, it's my understanding we're asking the apartment community to make a different unit available at that rate. So how, in planning for long-term financial structures in a multifamily, how should a developer or a landlord, owner of the apartment community gauge how many MPDUs they need available beyond the 15%? It seems like that could grow beyond 15%. And now we're putting them in an interesting financial situation.
And on top of that, is that you got a teacher, let's say, and this is to piggyback off of Madam Vice Chair, and they maybe they get promoted to assistant principal, right? And so their income goes significantly up, well over that threshold. So they're not required to move, and so the tenant or the landowner then has to identify another space too. So I'll see the nod heading there.
Yeah, that is how the bill is drafted. I think if the council felt like we wanted to adjust how that worked, we'd be open to that discussion.
Yeah, because would the landowner then be able to set market rate for that apartment if they have to find another one? The next available one that's an MPU, would they then be able to
I think that's a good point. I don't think that's how the bill reads right now.
Right. I'm going to go to Ms. Ledbetter. She was next in the queue.
Good. Thank you, Mr. Chair. I have a question, but also a thought. I'll start with my thought because it's related somewhat to what we're talking about. I think it would be very helpful, and I may just be speaking for myself, but to see the actual income numbers that you're working with, whether if it's a household of 4, if it's a household of 1, all the different variations, if it would be, possible to see that in a chart. I think it would help us to not do so much air talk and focus more on the numbers. So that's a thought.
Yeah, Councilwoman Ledbetter, we will provide that. I referenced in my presentation a family of 4, but we actually, Councilwoman Pickard actually asked for a full chart as well. So we will, after today, provide a full chart.
Thank you so much. I really appreciate it. And then the question in particular that I had, it caught my attention both reading the bill and then today, was the portion of the bill where it discusses if there's no consumer, whether it be renter or buyer, for one of these units, the ACDS has the right to come in and purchase. What happens from there with that unit?
Thank you. So we do have a program where we have scattered site rental units that we provide as rental units to the community at affordable prices for moderate income renter families and households. And so that would be included in that portfolio. We self-manage our properties because we think that gives, it helps us balance out our priorities to ensure that communities are stable and safe. And a lot of times we're doing this in areas where we're revitalizing the communities. So we have a pretty good track record and relationship with the neighbors and ensuring that those units are well managed. So that would just kind of be adding to the portfolio in a way it's a way to increase the number of affordable rental units in the community that can be offered at affordable prices without a long construction time and development time, because we know that can take a long time. And then the other escape valve is if say we didn't have the funds to purchase those properties, the unit can be offered at a market at the affordable rate to a market buyer, but the income the resale provisions would still stay on the house.
Thank you.
And those, how many people you have in your organization, in ACDS?
We have about 36 full-time employees.
How many people will be needed to execute this program?
So that's a great question. I actually have it detailed on the fiscal note, and it's about 4 people. Not all of them are full-time employees. And we do have the in-house expertise, but not necessarily, the current budget to support this specific activity. But the main staff person would be somebody that would qualify buyers and do income certifications, which we have a lot of experience doing for our other programs on the homeownership side. And then also we would maintain a list of eligible buyers as well as eligible renters. I don't think we're ever going to have an issue finding eligible renters because there's such a need on that front. We also offer, as many of you know, a first-time home buyer counseling program, which is free regardless of your income. And so we have a ready-made supply of buyers who are getting mortgage qualified in order to buy the homes. But it would be mostly a full-time manager and then some part-time, different staff to do different things.
For those projects, and this is for anyone, that in that 20 to maybe 30 range or whatever, do you foresee developers choosing to compress the amount of houses they're going to build or units they'll create so they can just pay the fee in lieu? So if they get to 19, they now have that option to do the fee in lieu. Was that ever a concern? Or
I think whenever you set a level, there's always a concern that somebody is if they're right on the edge, that they would play to the least costly level. I think that's a reasonable point. We have to set a level at some point, right? The reason we picked that particular level was partly looking at what it takes to do a development, but also sort of where projects break out in terms of size in this county historically. There is a large number of 5-unit or lower developments. There is a very limited number of these mid-tier 10 to 40, 50 unit developments, and then there's a ton of 100 plus, and you sort of see that scoop, and that data, the data that we'll provide you, you'll be able to see it. So part of it is, I think it's if it's a, let's just say it's an R5 and it's a what would that be, a 4-acre lot where they could squeeze in 20 units, would they maybe, or it's maybe a little bit more and they could squeeze in 21, would they maybe do 20? Maybe. But I think if you were, I don't think you would see somebody go from a 30-unit development down to a 20-unit development. That just doesn't seem to pan out in other jurisdictions.
Hold on, Ms. Keeler.
Thank you. So we discussed the scenario that a renter who would be able to apply is at a certain income threshold. What happens in the circumstance of an owner going above the income threshold? Are they then forced to sell?
No, once you qualify under home ownership, it's your property, subject to the deed restrictions. So there's a control period that holds the deed restrictions that it be a moderately priced dwelling unit for 20 years. So you could, in 10 years, decide to sell. You could wait 30 years and sell. In the example where you sold at 10 years, the moderately priced dwelling unit affordability calculation would have, which would set the sale price. You would get all your equity that you had built in, and you would then have to sell it to a qualified buyer. If it was if you were there 30 years, there would be no deed restriction, and you would be able to sell it at market rate.
And in that sales scenario, who would make sure? Would it be the seller or the administrator that makes sure that it's sold at the appropriate rate, depending on when it's sold?
There's a recorded deed instrument. Okay. So I guess it would be on the process of selling the property that would get flagged and that the administrator would get called in.
So staying in the home sales, I would assume that there would have to be some qualifying for mortgages, financial qualifying. Okay, is there any check for line of credit for renters to make sure that that would be something kind of the counterpart to household ownership, the renter financing?
Do you want to talk about the qualifying? Yeah.
Yeah, so we would qualify just to ensure that they meet the code eligibility requirements, but the property owner would have the ability to impose the regular screening criteria such as credit and criminal background check and things like that.
Okay, is there a section of the bill that points that out?
I don't know that there is.
Give us a minute. Well, the smarter people than me are looking. It was never our intent to restrict a landlord's ability to do that kind of renter screening, which under our fair housing law, they would be allowed to do as long as they apply it in a non-discriminatory way, right? So you can't apply a separate screening rule for a non-moderately priced dwelling unit versus a moderately priced dwelling unit. But if you apply a credit check on all your tenants and a reference check on all your tenants, you would be allowed to do that. And if we can try and find if there's explicit language in the code, but it's our interpretation that you would be allowed to do that.
Before I go to Madam Vice Chair, since we're on this, the House piece that was just mentioned, let's say I purchased a house and qualified for that program. 5 years later, I got a significant job. I know the control period is, you said 20 years. And I added and let's say the house was $300,000 when I purchased it. 5 years later, I got a great, awesome job. I'm now the principal of North County High School, excellent high school. I think Mr. Jefferson's probably going to say, don't bring me up. And I wanted to put an addition on the house because I should be able, it's my house, right? And the value of that house now is at, I don't know, $550,000 or $600,000. Like I double the value of the house. So when I go to sell it, how does that work? Like if I sell it before the deed restriction of the 20 years, let's say in 10 years, after I put this addition on there, and then life happens, I get a divorce, which technically I did get a divorce here a few years ago. TMI, but you know, we're family, right? We're family. This is a tough subject. And we go to sell that house.
It's a great question.
How does
Mr.
that
Chair. Page 12, top of page 12, talks about the resale price. Fair market value of improvements made to the unit during dates of ownership would be included.
But
so you would get the value of your improvements.
But if I'm a buyer and I'm looking to buy that house, what do I buy it at?
Equal to the prior sale price plus a percentage of the moderately priced dwelling unit sale price equal to increase of calculated cost of living calculated using consumer price index, dates of ownership, fair market improvements, and reasonable sales commission to the seller. So if in your example, you know, you put in like a marble palace,
you know what I'm saying?
Addition. I know what you're doing.
That's how we do it.
And you somehow like force that unit outside of affordability. I think that's a sort of a very unique and probably rare outcome in this.
Would it? I mean, I think homeowners do updates.
Well, yeah, I mean, you do updates, but to push it outside of affordability, I think it would fall to the other rules in the bill, which would allow you to still sell it either to ACDS or the housing authority. If they refused, then you could sell it at that qualified price to a non-qualified buyer. So there is still an exit on that.
Right, but in that instance with the house, I've now priced that asset, but it still has a deed restriction on it for at least another 10 years.
It would still have the deed restriction, but you would be selling it to, and that's the trade-off here. You got the house at a bargain. So I mean, that's the trade-off that you've put in.
Oh, the incentive is to me not, but okay, I think that's you're when it comes to that piece. Madam Vice Chair.
Thank you. Just to piggyback on that, it's not related to the questions I have, but so this isn't about, an MPDU program really isn't about, at least in the homeownership, we're talking about homeownership, when we build generational wealth to a home investment. It's really not what this bill is about. It is one of the biggest issues facing the United States, is that wealth gap. Most families gain their generational wealth through homeownership, and we haven't moved that needle since 1968. The wealth gap between minority communities and homeownership and white communities has stayed the same or increased. We've done nothing in this country to eliminate that wage gap, but this bill is not about that. When you purchase an MPDU unit, you will not get the market value when you sell unless you're outside of that control period. We mostly sell our homes about an average of 7 to 10 years. Don't quote me on that, but it's something like that. So that's not what this housing policy is about. It's not about making sure that homeowner, that first-time homeowner, is going to get an increased equity out. That's not what the bill's about. It's a choice. This has other. The administration went with this policy for other reasons, but that's not one of them.
Well, since we're speaking for the administration here, I mean, the councilwoman is correct that it limits the amount of generational wealth building. This policy is primarily about creating additional affordable eligibility and units in this county. But you do get a modest increase in eligibility, in wealth by doing this, because you are able to sell it at a, under page 12, line 1, section C, you are able to add certain CPI growth to it. You are able to get the equity that you put into it back out. So in the situation where somebody might not be able to get into the home ownership market and instead would be renting versus getting an MPDU, where Councilwoman is correct, you get less build inside that control period, but it is not nothing. And I would just want that to be clear.
Mr. Chair, I have questions. So back to, I did send both of these questions to the administration in advance, but I do, one of the benefits or incentives that is touted in the county executive's community relations regarding this bill is the density bonus. So let's take a minute to talk about a 10%, 15% density bonus in Anne Arundel County. So I did send some questions about the average net yield for residential subdivisions by zoning type, R2, R5, R10, R15, and R22. By the way, we only go to R22 as density in this county, which is very low compared to many of our neighboring jurisdictions. So if a property is zoned R22, when completed, how many units per acre are yielded on average? I know the answer, I think, to this, but I really would like to understand it, because when we talk about a density bonus of 10%, no matter which zoning, especially in our lower density regions, we're not getting that yield, and we have other bulk regulations and lot size minimums that are going to not allow for a density bonus once we include forest conservation or stormwater management or all the other things. So I'd like to talk about that, and is that density bonus set at the right number to actually, well, actually, if we were to increase it, could a developer even get that yield based on other bulk regulations of those lower density areas? Am I asking that question right? Because I have like 20 more.
So I think it's a good question, and I think, you know, when we circulated the bill around, the effectiveness of the density bonus is a question that was raised, which is why there are additional other incentives that have been provided to the development community. I'm going to ask Lynn Miller from OPZ to talk a little bit about that data about yield. Thank you for sending the questions in advance. I think we are able to tackle it now. If not, we'll provide additional information after the work session. Michael Stringer.
I'll let Mr. Stringer speak to the yield data, and then I can talk a little bit about the maximum allowable densities.
Hi, Michael Stringer with Office of Planning and Zoning. And Councilman Picker is correct that, you know, when you do actually develop a property, our zoning sets a maximum density. So for R22, it's 22 units per acre. But then you always have to subtract out, well, I need space for roads, for parking. The site conditions don't allow you to typically get to that full maximum. So as a county, we do, in Office of Planning and Zoning, we do track periodically and look back and see what those yields are. We use those calculations for when we do the holding capacity, development capacity analysis of how much land is left in the county that can be built on, and how many units can we project are likely to be built there. So it varies, right, project by project. So we look over time and look at average. We actually just recently updated these numbers last year. We looked at about 270 approved subdivisions over the last, about the last 5 years. Very few of those were actually R22 zoning, but as we look back from the kind of 2011 to now period, what we've averaged on the R22 is that the actual achieved average is about 20.7. So that one's actually pretty close. And for some of these, they do vary. When you go down to R5, Our average yield is 3.5 units per acre. Again, the maximum density would be 5. The average that we see actually achieved is 3.5. I should note, actually, we use median rather than average. Go back to like Statistics 101, that median gives us more of a center value, doesn't get skewed by some high-end project. R10, instead of 10 units per acre, we typically see 8.4. When you look across all those zoning districts, it tends to be about 85% is the yield of what the maximum is.
So as you, thank you, as you crafted this policy and looked towards incentives, since really we're not achieving by right densities, is there any appetite with the administration to look at more commensurate code incentives that would make this more impactful as we try to tackle our housing crisis?
So what we discussed the other day, Councilwoman, and I'll repeat it here on the record, yes, the administration would be open to talking through how we do it. I think there's some challenges that it's very easy to say, it's very hard to write, right? As you know, as you've been doing your missing middle, it is not a thing that we can just scribble down and say, okay, well, you get a little bit more, because there are all of these factors that are at play. We do think we've crafted a bill here that provides enough incentives to ensure that the MPDU production will occur. If there are ways, for example, that we could allow in certain zoning districts, particularly those lower yielding ones, additional MPDU units in the underlying density that doesn't impact in a negative way the community, like you've talked about with missing middle. What were we talking about the other day? Semi-detached versus duplexes and all of those types of units. If we could figure out a way to write it in those news, I'll say it on the record, we'd be open to having that discussion, Councilwoman.
If I may, Mr. Chair. I appreciate that, and getting to something like that may be necessary to get my vote on this bill if we get there. I wanted to give Mr. Stringer an opportunity, since I think you mentioned the opportunity to talk about the holding capacity. And we have 3 region plans that are in draft form, and they're up for the public to comment on, I believe, right now. And each of those plans talks about the holding capacity in those regions. How much land do we have at the different zone to create and tackle this housing? And in that, with each of those plans, there are challenges and opportunities. I didn't really have a specific question. I really wanted to take an opportunity to go through them. And if you don't mind, Region 2 is the one I have highlighted. Because it is interesting as we go through we've been through Plan 2040, and now we're in region planning, and we have very much targeted land use policy into driving residential construction in certain areas, in targeted growth areas. So where we look at overlaying a mandatory residential housing policy on top of all this land use policy and zoning policy, it's interesting to me. I live and breathe housing policy. I've read every book on the market. So I really do want to understand. If it's not obvious from my line of questioning, I am concerned about this policy constraining our housing construction. I'm also not really on board with the inclusionary nature of our policy, because we don't have land zoned in our communities of opportunity for multiple dwelling types and things like that. So where our teachers that work at South River High School want to live near South River High School, we're not really building in that area, and we're certainly not building multifamily in that area. So anyways, Michael Stringer, I'll get off my soapbox. Will you explain the housing capacity and holding capacity of Region 2 on this draft plan, please?
Sure. Again, Michael Stringer with Office of Planning and Zoning. So holding capacity is a tool that we use to estimate some of these basic questions of land use planning, which is how much land do we have left in the county to develop? That gets married to the question then of saying, well, how much more growth are we expecting? And then how do these two things meet? Now, before I talk about that, there are multiple tools that we have to kind of answer these questions about kind of the capacity and demand, right? When we look at water and sewer master planning that this council reviewed last year, there were detailed analyses about that system. We also look at this question kind of in terms of recreation parks with the Land Preservation Parks and Recreation Plan that came before this council last year as well. What's the population growth? What are facilities? What's kind of standards of how much supply is needed to meet the demand of the population? So when we look at holding capacity, the question is really just based on that raw ground. How many acres of land are left in the county that are either vacant or underutilized that could be redeveloped? And then if we apply the zoning and the yields, so kind of the actual achieved densities on these properties, what do we expect that could support? So we regularly publish this information. It's in Plan 2040, the General Development Plan. We also put it out every 3 years per state requirement in the Annual Measures and Indicators report that goes to the Maryland Department of Planning. Big picture, when we look at that, you can see we break down these two pieces of what's left that's vacant. That's kind of what we typically think about. What empty lots are still around that could be redeveloped? And of course, that number has been decreasing over time as the county develops. But we also look at what's underutilized. And for both these classifications of vacant and underutilized, we actually look at the state tax assessor data. We say if the assessed value of the improvements, so any structures built on the property, is less than $15,000, we say that's vacant. If it's got an improvement value that's less than the land, then we say that has redevelopment potential. And that's kind of a quick market review of saying, looking at properties across the board, what seems to have development potential? So when you look at properties, say like down Riva Road that we've seen redevelop, historically there were vibrant businesses there, but then structures declined, but the land value increased because of demand. So now all of a sudden it looks like an opportunity to redevelop. So it's a dynamic model that as we run every time, those assessed values change. So the numbers respond. The latest numbers that we published for this were in the 2021 Annual Measures and Indicators report. And we indicated that in the residential zones, there was about 13,000 units available to be redeveloped between that vacant and underutilized. What's also interesting in this and kind of harder to quantify than too is that we also, of course, can build a lot of residential on our mixed use, our commercial zones underneath different conditional use provisions. So we estimate that there's probably over 20,000 units that could be built in those kind of non-R zones for a total of about 35,000 units in the county. And then Ms. Pickard asked about kind of the direction for where those units are being allocated. That goes to our forecasting of future population growth. And the county does that in partnership with our surrounding jurisdictions through the Baltimore Metropolitan Council. And every couple of years we update this model looking at population trends, looking at census data, looking at also what's in the development pipeline, what projects are coming online. And we do estimates of population, households, and then employment growth. Those numbers at forecasting is always difficult when you get to small geographies. So we usually, we apply that looking at countywide, but then also we look at it, we do parse it down to smaller areas. So you see numbers put out in the region plans for what this region is kind of expected to grow. It's not a growth target. It's not what the county is guaranteeing is going to be built, but we're preparing for it as we think about the infrastructure and land capacity to see, again, what are we expecting? What are infrastructure systems? What can they handle? And what land is available? And following on the county's growth management policies since the late 60s, early 70s, we do have those foundational ideas that in the South County, we're intending to keep that rural, support the agricultural economy, and kind of avoid the cost of extending additional utilities in South County. So that growth tends to get focused more towards the north and west side of the county where we have greater infrastructure capacity, where we have those large employment centers. So you see those numbers reflected as well as you look at the region plans. We're projecting there's going to be more growth in Region 2 than in Region 7, for example. So over in West County, more than over in the east side of the county.
Thank you.
Ms. Summer?
So I have, if it's okay, I have several questions about the fee in lieu section that I'd like to ask about. The first is that there's an opportunity to get the fee of lieu to be exempted from the MPDU requirements because of exceptional circumstances. And that includes the cost of an individual package of resident services and facilities to be provided would likely make the moderately priced dwelling units effectively unaffordable. So that reads to me that, and that is section 1712, 105, that a developer could work around this by just adding a lot of extras to their community that would make homeowners' fees, for instance, unaffordable. And who is going to decide if that cost of amenities is going to be too high to make it qualify? I know of homeowner associations that charge multiple hundreds of dollars a month for the different amenities and things in their community. So who is going to set that threshold, and how are we going to, what means is there to keep us, that this is a way to kind of skirt around being offered to MPDUs? I know they would still have to pay a fee, but this one seems a little nebulous to me about how that would be determined.
It's a good question, Councilwoman. We struggle with this language because if one size doesn't fit all, right? There has to be some professional judgment applied. Could a developer add a pool or something that would create additional costs? Possibly. Could they just add a bunch of fees to the neighborhood that chase the MPDU out? Possibly, but then they still have to sell those market rate units in the open market. The bill is structured to allow the administrator to make those judgments. And if Aaron, it's the planning and zoning officer. I should have read a little bit closer. So that comes through the development process. So they would have to provide the proper information to make that. So we did, there's the individual package, but there's also the developer's situation on the ground, and that's on the top of page 9.
Mm-hmm. So, okay, so then looking at the next one, so you're saying OPZ would make these determination, make that determination.
Sorry, I misspoke. Yes.
So in the next bullet of number 2, it says compliance with the requirements of this title will result in the applicant being unable to secure a reasonable return from or make any reasonable use of the property, and the hardship is unique to the property, is not due to the zoning classification, is not the result of the applicant's own actions. Could you give me an example of what could fall under that? Who would determine that, and how would that, what exactly?
So when we discuss this internally, it would be a situation where, to Councilwoman Pickett's point before, you are not always able to get to the maximum allowable under the zoning classification. So, for example, there's a wetland in the middle of the parcel, so we can only squeeze 4 houses, even though it's, by right, we could build 10, or there's forest conservation requirements because there's aphids or specimen trees or stuff like that. That's what we envisioned when we drafted it.
All right. And then another, as we go down, the next one, the amount of contribution, if they do fee in lieu, it would be it says that for this, if they sold it, so it would be 1% of the purchase price of the market rate unit. So for instance, let's say it's a development of 20 houses or 19 houses, and they're going to do a fee in lieu because they're under it. Would it just be calculating how many of those houses would normally fall under MPDU, and you would have to give 1% of that, of those, just those specific houses? I just want to clarify. I think that's what it says, but I wanted to clarify that.
I mean, it's 1% of all units.
1% of every unit, not just the ones that would be marked as MPDU. And that's the same with the rental units. It would be every rental unit, or the 15% of rental units that would have been required if it was providing units.
Yeah, it's all units, yeah.
It's all units. So they're going to have to pay 1% of every unit in that complex for the next 40 years.
Or provide the MPDU unit.
Well, they pay that annually.
They're going to have to pay 1% annually. No.
It's a one.
It says for each year of the 40-year control period. So it's going to be every year they're going to have to pay.
We intended that to be the calculation, I think. You would calculate it out.
That they would pay it one time is what you're saying?
That was right. Is it each year?
It is each year. This says each year.
I'm sorry, so I just, so the 1% is for the sale. They pay that one time.
Right.
For the rental, it's the difference between the actual rental income for a market unit and the MPDU unit. It's the difference between those two calculated over the 40 years. And so then they can pay it annually, or they can pay it all at one time, reduced to present value. So the 1% only relates to the sale units, and that's all units.
So for the rental, it's the difference between the actual annual rental income for if it was an MPDU and the maximum rental rate.
For the MPDU.
But you're saying that that would be for every unit in that building, not, but it seems to me it should be just for the ones.
For the rental, it's just for the MPDUs. For the sale, it's all units.
For the sale, it's all units, but for the rental income, it would be, this would be calculated only for the number of rent, if they had provided MPD units, say it was going to be 5, they would just pay that difference each year for those 5 units, not for the everyone in the development.
Right.
Okay. And so, and it says, but if approved by the administrator, a single payment could be made, or they could do it annually.
Right.
But
so
it would have to be approved by the administrator, which in this case would be ACDS, not OPZ. That would be, the administrator would be ACDS.
Correct. Okay. If that's, yeah, correct.
All right.
Before I go down to Ms. Ledbetter, just to follow up on that. So for since we're on this fee in lieu, if you got 19 units and they choose to do the fee in lieu, let's say they were building 19 houses, is it the market rate of those houses, like if they were selling them for 500,000, so that's like 9.5 million, somewhere around there. And if they were to do the fee in lieu, it's 1% of that 19.5 million. So that's $95,000 that they would pay a fee in lieu of for those 19 houses they were going to build instead of building the MPDU. And if they pay the fee in lieu, they still don't get the wavering of the connection charges and things like that. That's still
Connection charges and hookup charge waivers are only for the MPDU units.
Right. Okay.
Not for the whole development.
Not for the whole development.
Right. Okay. Ms. Ledbetter?
Thank you, Mr. Chair. I want to take us back, and I apologize, but I know people are going down different lanes, but the conversation the chair started about the improvements to the home, Ms. Pickard's point, which I appreciate you making, the difference between one particular type of housing policy that may have been concerned more, well, fueling or facilitating the wealth generating portion of homeownership versus what this bill is going at. And I just want to make sure I understand it 100% clear. And more importantly, I want to make sure that the public understands it very clearly. So we'll go to Mr. Smith's example. It's an MPDU unit. I buy it. I qualified for it. It's my home. I put an addition on. I do all my new amenities, crown molding and luxury floors and the whole 9 yards.
But no divorce for you, just saying. No divorce for you.
Thank you. I appreciate that. I would like to stay married to my wonderful husband of 20 years. So I understand, I just want to make sure I understand the way it's written in the bill. Mathematically, it would be possible that a homeowner could improve their property to the point where, because of the cap set by this bill, it could be possible that if they do enough improvements, that the price point that they could get on the open free market would actually be higher than what this bill may allow them to do. Is that correct? I know it may not be every case, it may be rare, but it could happen.
So, yeah, I mean, the way the calculation would work is CPI and increases year over year are added to that base price. The fair market value of the improvements are added to that base price. So that would, it could theoretically create a price point for that unit that would be, would not be affordable for somebody of moderately priced. Because I do want to talk a little bit more about the sort of the intent of this bill. I mean, like I said to the previous question, there is some wealth building that happens, but this is also about expanding housing opportunities, right? And this is creating inclusionary policies that put moderate price point folks in communities that they would otherwise not be able to access. So if you are one of those people getting it, you are getting a benefit on the front end. And so the trade-off that you're making is, yes, you are giving up some economic, or what do they call it it's some opportunity costs.
There's an opportunity cost.
Yeah, that you're taking up during that control period.
Okay, and so my question has to do with that portion, so I wanted to make sure I understood it properly. Is what kind of education, is there a plan for some sort of education to happen so that the buyers who would be purchasing these units understand fully and completely that opportunity cost? Because it is so different than what you hear about home ownership. It's what, you know, whether it's the real estate industry, whether it's movies, like pick your deliverer in the media world. But there is definitely I think the general population sees homeownership as a chance to build equity and build wealth. And so I think that means that there's a huge onus on the administrators of this program, to make sure that people who purchase these homes would understand that opportunity cost. And I just want to ask, is there a program like that in place? Is there something planned? Do you have the manpower for it? That's where my question is getting at.
So we don't have a moderately priced dwelling unit law in place, so there's not a direct correlation. I will say that, you know, I want to be clear that the folks that are getting this are able to build some equity during it. There is equity build. And then I'm going to ask Erin to talk a little bit about what her home ownership stuff talks, and if Jansen seems to want to say something too, so I might ask him to say something.
Sure, I appreciate that question, Councilwoman Ledbetter. We do, as I said, we have a first-time home buyer counseling program, and a very qualified staff of housing financial advisors. We don't call them housing counselors because they are really astute in knowing, the ins and outs of the financing, as well as any, deed restrictions that might be placed on the property. From time to time, we administer special programs. For example, I mentioned we administered the City of Annapolis's MPDU program, and we have special home buying workshops and special efforts to counsel those home buyers so that they're made aware of what they're getting into. Because you're right, it can be just home ownership by itself can be very complicated. So when you place these extra deed restrictions and resale provisions on something, we definitely want our low and moderate income home buyers to know what they're getting into.
Thank you.
And I've been trying my best to not say anything. But I definitely want to follow up to what Aaron just said. I mean, if you're getting counsel for this program and you meet the eligibility requirements and you're then purchasing a home with a deed restriction, like, let's be very clear about that, just to answer the chair's question along with your question. If you're purchasing a home with a significant deed restriction, and then you then go ahead and decide to, once you're now making more money 10 years from now, you decide to overly invest in that, then you would be going against the education that you've received. You'd be going against logic, because ultimately you would then be pretty much invested against yourself. But I also want to very quickly just go back to, I think that many of us that are in this room that we take a hard look and we try to study some of the issues surrounding the housing crisis that we're in. And when you look at some of the literature, yes, many of the literature talks about the generational wealth gaps that disparate communities have had for generations. But the crisis that we're facing is not just with respects to generational wealth. I want to be very clear about that. The crisis that we're facing also deals with housing accessibility. When it comes to the amount of stock, when it comes to the individuals that are able to have housing and to not be housed in the way that their incomes are stretched to the maximum and they're not asset limited, income constrained, yet employed. This is what this particular bill is focused for. So just like when we address this multifaceted, interwebbed, interconnected housing crisis, we are looking at the many ways that it has to be addressed. It's not just up in school APF so that more homes can be built. It's now that more homes can be built, we ensure that individuals who are in the missing income bracket, those who are unable to access the low income housing tax credits, those who are unable to access some of the many programs that you have on the federal, state, and even local levels, that they have an opportunity to be housed in a way that they're not rent or income constrained. So I just want to be very, very clear about why this administration, in terms of I'm the biggest proponent of missing middle housing. It's necessary. It is completely and utterly necessary. But what's also necessary is that we improve access to housing opportunities for the individuals that we deemed and we claimed and we held up as heroes during the pandemic, which include many of our public safety employees, which includes our educators and so many more. So when we address housing policy, we have to, some policies will be all the above, some policies will be this, some policies will be that. This policy is that. So I hope I answered the question specifically in terms of like the question that the chair and then you had also answered.
Yeah.
Okay.
Thank you. I have a couple more. Again, I'm thinking about the process involved, and specifically on the purchase side of the house. No pun intended there, but no confusion intended either. But going back, the deed restrictions, is there the deed restriction? The new buyer is ACDS. Is that who is going to be the approver, the qualifier of the new buyer?
Yes.
And how will do we have a plan in place for how we're making sure that communication, that information is communicated out? I mean, real estate transactions, there's so many different hands in the pot, from your title agents to your, the folks who pool the land records down at the courthouse, real estate agents, all of that, to make sure that a sale process didn't start to snowball.
Sure.
And then you have a crisis.
Yeah, and
a crisis at the table is a disaster.
Sure, and I think, to your point earlier, first, education, and so making sure that the initial buyer knows that when they do the resale, that they are going to have to get their buyer qualified through ACDS. But we know that sometimes people forget or they don't go through that process. And then the safety valve is, from time to time, we have the very same thing happen on other properties that we've sold and have deed restrictions on, and we do get notification from the title company. And sometimes that slows down that sale because of the deed restrictions, but that's when we step in and do our thing. So the process has worked pretty well. Are there going to be glitches? Probably, but I think overall the process works pretty well.
And one thing that we did include in sort of this, I picked his. One thing that we did include, and this came from some of the feedback that we had heard about making sure that the county was ready on day one with this policy. You'll notice the effective date is July 1st of next year, which gives ACDS and the Planning and Zoning Office and county government the ability to get ready for implementation, as well as the advantage to the market to adjust to the new reality of having this requirement in large developments.
Good, thank you. Just one more. It should be a short one. Is that okay?
Good.
A huge part of the real estate sale process is the appraisal. I've heard from a couple constituents who just looked over the bill briefly, some concerns about how having a different type of home amenity level in the home may affect appraisals within a neighborhood. I'm just curious if you have, obviously this is, but you cited in your presentation where, this has been done in other places. Is there any data? Do you have any sort of feedback on appraisals for comparative homes within the neighborhood?
We'll have to look into that. I'm not aware of any data that shows that this has a detrimental effect on the market rate units surrounding it.
Thank you.
Before I go to Ms. Rodvan, it is for the appraisals, wouldn't the home still appraise? I mean, the value is the value. It's just what you sell it for.
Yeah, I think the concern's probably coming from comparables, right? If you have in a neighborhood,
right? No,
I'm looking at different.
Right, got that.
I haven't heard of this concern, and I'm not aware of any data that shows that it has an impact.
Right. No, my question is specifically to the unit itself. When it gets an appraisal,
the appraisal should take into account any deed restrictions if the appraiser is doing their job.
Okay, Ms. Ravian,
Thank you. Okay, I have accumulated a good number of questions as I'm thinking about this, so I'll try to go quickly. I've typed them up so we can move quickly. So on the purchase side, for an MPDU, what is the basis that the county will use for a tax assessment? Will it use the market value or will it use the MPDU value? And if there's no decision, I'm going to advocate for the MPDU value. Or maybe put that in as amendment.
Yeah, so the county doesn't do tax assessments. That comes from SDAT. SDAT should take into account that it is an MPDU unit. That's a good question.
Is there any way we can just make sure
we can write SDAT
get confirmation on that?
Get confirmation because the other jurisdictions have this as well. So I'm sure it's something they're used to it. Yeah. But we'll confirm.
Okay. So I wanted to ask again. This is on the ownership side. Oftentimes a homeowner will, create a will that passes the home on to a family member upon their passing, would the eligibility requirements kick in if they had passed on that that home in a will? Or, you know, I guess there's other scenarios that house could be transferred, you know, like in a divorce situation where, you know, would that trigger?
Those are really good questions, and unless Ms. Blair Klausmeyer has an answer, we might need to look into that.
Okay.
I mean, the best I can say is the resale restriction is the resale restriction. I would think that if it passed through an estate, that person then becomes the owner without actually purchasing. So you would look at the next purchase for an actual resale. Because what's actually happening here is, you know, while you live, it's kind of similar to the rental situation. If your income increases, there's no real consequence to that while you own the property. The restriction is on what happens to it when you sell it, and how that resale price and who it gets sold to is where that restriction comes in. So while you own the unit, you're not really looking at that income restriction in and of itself. So, and the deed restriction would be on resale at that point. But that person that inherits it, if it's during the control period, would be subject to that resale provision.
Okay, got it.
That makes sense.
And so with that, I really want to push back on the idea that this doesn't help generate additional generational wealth, because in that very scenario, the control period could very easily expire if you have, you know, one generation passing on to the next, and then that next generation would have that house, would own that house at market value. Now, of course, that depends on one, you know, particular scenario, but I think that that's a very realistic scenario.
That is correct.
I also just thinking about, you know, my district in particular, a lot of the longest time residents in Annapolis are African Americans who have been pushed out of, you know, in various ways, have been pushed out for all the discriminatory reasons. And this, I think, creates a really good opportunity. Of course, now we're talking about county, not in the city, but I think it's still a relevant, you know, a relevant consideration. Let's see. Oh, and again, on that, the building equity, I mean, the biggest obstacle that most people have to home ownership, and I'm sorry, I'm just making a case for this bill, which will have lots of opportunity, but by having a lower price, that means a lower down payment, and down payment is the single biggest, at least by my reading and research, that is the single biggest obstacle to home ownership. So you're gonna have more people that had not been able to accumulate equity in their property because they had to rent it, all of a sudden now being able to accumulate equity in the property because they own it. And of course that increases over time. And would increase proportionately, right? So if you're at, you know, a certain percentage below the market when you purchased it in the year 2023, and you want to sold it in 2033, none of us live that long, 2033, even 10 years, that, you know, that affordability at AMI-X is going to increase. And so you're going to get that part of the increase of the equity, even though it may not be as significant as it would be on the $500,000 or $700,000 home. But on the $300,000 home, you're still going to get that. And maybe even, you know, MPDUs, because of the density bonuses, are likely to be a little bit smaller as we continue to grow. Even smaller houses can be, you know, can appreciate pretty significantly, and sometimes even more, because they make up that part of the market just by their size that is, you know, more affordable. A 1,500 square foot house versus a 3,000 square foot house, you know, is going to be closer to an entry level purchase, even at market price. So I think there is a huge opportunity here for building, for wealth building here. Okay, so I'll get off that soapbox. I'm curious how the administration would feel about including, so in order to participate in the program, a county employee of Anne Arundel County, AACPS, and what's the other?
City.
Oh,
the city.
That's embarrassing. City of Annapolis employee. How would the administration feel about including some of the entities? I'm not sure how they fall under. I know I sort of asked about this in an email before, but you know, library employees or community college employees, and if there are any other entities that we might, you know, want to include that are, you know, that are place of employment is in the county.
So the eligibility, you have to be a, let me find it real quickly. You have to be a, there it is, where is it? Page.
I think it's page 9.
Page 9. Yeah, so line 48-ish. Provide proofs at least one adult member has been a resident or employed in the county, including the city of Annapolis, for at least 12 consecutive months. So you have to live here or be employed here for a year. I think I might have mangled this when I said this earlier in the day. Prior to the date of filing their application, or is currently employed by the county, city of Annapolis, or as a teacher for the county board of education. So if you live outside of the county but work in the county for a year, you fall under the eligibility requirement.
But not in those particular entities, not the library and the community college.
The library and the county employee, city employee, or teacher, you don't have to be, it doesn't have to be for 12 consecutive months in advance. So you could, we could, to answer your question, if you wanted to bring an amendment that added those entities, we would happily entertain it.
Okay, that was really the gist of my question. And then this is just a calculation question that I'm guessing Ms. Karpowitz can answer. We talked a lot about, a household with one adult income, and then we talked about a family of 4. What about the other scenarios? Like you have, one adult and 6 children. Does that impact the affordability calculation? Or say you have two adults and no children?
Right, it's based solely on household size. So whether there's multiple incomes contributing to that annual household income or not. So we would look at whether it's 1 adult and 5 kids or 2 adults and 4 kids. We would look at all household members' income and take that into account, as well as like interest income and things like that.
As well as the additional cost for each additional member of the household?
Well, and that's why the eligibility is graded, gradually adjusted based on household size. So having those higher income eligibility takes into account the fact that you're going to have more expenses the more children you have or the more household members you have.
So even though the bill doesn't mention specifically, 2 adults, household size of 4, there would be a separate calculation for 2 adults, household size of 8, for example?
No, there wouldn't be a separate calculation. It's just one calculation based on the actual household size. So if you have,
So 8 would be calculated as 8?
Yes.
Okay, so not as 4?
Correct.
Okay, I think that answers my question. And let me just look and make sure I didn't miss anything else in
And
the
just
paper.
to add to that while you're looking, I think it was Councilwoman Ledbetter and I think Councilwoman Pickard had asked it earlier, we will be providing those income eligibility charts as they stand today. But remember, they get adjusted at a regular clip.
Thank you. I think that's all I got.
Ms. Fiedler, and I want to go to
Thank
Madam
you.
Vice Chair.
I'm going to go back to one of my earlier questions just for clarification, because Ms. Ledbetter asked a question, and in the response, it was said, if you get it, meaning a unit, if you qualify. So there are disqualifiers too. So these units are not guaranteed. So if you apply and have terrible credit, people have been there in their life, robbing Peter to pay Paul to get by. I just want to clarify that these units are not guaranteed, that there are disqualifiers in the process.
Correct.
Okay. May I?
No.
Okay. Thank you. On page 7, line 47 through page 8, line 2. If I'm reading this correctly, these types of development, the houses, whether they are MPDU or not, will all look very similar in size and exterior aesthetics.
That was the intent of that language, is to ensure that they fit within the community. Whatever the community decides to look like, that they fit in it. Yeah.
So my follow-up question to that, I think of developments that are in the 5th district and relatively new that we're trying to reach a diverse price point of homeownership. They are those communities where you have townhomes in the center and then single-family homes on the exterior. In this bill, you could not do that.
No, you would be able to do that, and because we talked about just that, it would be the proportion. So if you're gonna do, again, using simple numbers, 100 townhomes and 50 single families, the MPDU requirement would have to match that distribution. Does that make sense?
Yes.
So sort of 2 to 1 townhome to single family MPDU.
Okay, so the requirement would be that some of the single family and some of the townhomes would be MPDU.
Yeah, in the proportion that the development is built, right? So, what's that? 10%. 10% of each, yes. Yes, thank you.
Okay.
So you would match, so to try this example again, right? Simple math, 100 townhomes and 50 single family, 10% of each. So 10 townhomes would have to be MPDU and 5 single families.
Okay, thank you for clarifying.
And that language that she pointed out was that just to ensure that the dwelling units themselves do not vary in scale, scope, sort of almost like Three Little Pigs, right? You don't want the houses made of brick and then they build the MPDUs out of straw, right? And sort of prevent that sort of situation.
Exactly. So you're allowed some flexibility on the types of finishings, right? But the structure has to be the same.
Yeah.
Ish.
The interior amenities.
Interior amenities.
Never thought Three Little Pigs would actually come into a council meeting session, but my brain works that way. Madam Vice Chair. Madam Vice Chair.
Thank you, Mr. Chairman. We've been all over the place on this bill. It's clear that it's a big policy that touches a lot of things, but it is mandatory unless you're, for those developments over 20. So it is a mandatory housing policy that will overlay all residential construction except those that you're exempt from. My head is spinning a little bit. We have, we learned in our school APF conversation that new construction accounts for about 1 of every 7 resale in the county. So I'm coming back to, I'm going to bring the administration back to supply, housing supply. And I'm disappointed that we're having a conversation, I'm disappointed that we're not having a housing policy conversation that really tackles the supply constraints in the county.
If I can respond, Mr. Chair.
Well, I haven't finished.
Oh, sorry. Okay.
We have talked about, and I've helped collaborate on a redevelopment bill. We've talked about transit-oriented development housing policy. We've talked about reforming our mixed-use categories, and I'm actively engaged in a middle housing work group. Our workforce housing policy is voluntary. It has similar financial incentives to this, but the density bonus and the zoning, being able to build workforce housing in C1 and C2 and C3 and W1 have really made that successful. And we're seeing, although that policy needs a little tweaking too, so that Anne Arundel County remains competitive as we go out in search of 4% and 9%. I'm curious if there's a way forward where this essential worker legislation could be voluntary as well, with a more robust and maybe different incentives than in the workforce housing policy. And potentially be more impactful than how it's written today. Is there any appetite for that conversation going forward?
So we looked at voluntary, we looked at other jurisdictions that have voluntary. It is the opinion of the administration at this point that we would oppose an effort to make this voluntary. I think to your point about other parts of the housing access discussion, the administration completely agrees that there are multiple tools that need to be deployed in the toolbox. There are multiple different changes that need to come, and there are changes that we've made. To your point on the workforce housing legislation, we have supported improving that legislation. We're actively working right now with stakeholders on a redevelopment bill, and county staff is engaged as appropriate in some of the missing middle work that you're doing. So I think all of those things need to happen, and this bill, we think, is a piece of that overall structure.
Mr. Chairman.
Oh, yeah, and actually, if I can add on the voluntary, if you look at Baltimore City and how their MPDU program has utterly failed, part of it is because of the voluntary nature that requires the city to actually put, and granted, their market's very different than ours, and there's all of those caveats, but the voluntary piece of it, it killed the program.
Well, so that's a very interesting point, because having worked on this work group pre-COVID, coming to the same conclusion that I'm at now, and talking with Frederick County, another county whose MPDU program produced no units, but was actually a tool with using their fee in lieu to fund their affordable housing trust fund. So they've been spending, probably since 2020, they've been engaged in a very extensive work group about how to reform their MPDU policy. That's not the tack that we've done here. We took a bill from 1998 or so, and we started working on it 20 years later. That paused for whatever reason. That work paused before, COVID. But we've just resurrected it this summer in between all this other work and given different stakeholders an opportunity to look at it over, 6 weeks or however long. This is a big policy. I know we need lots of tools in the toolbox, but this is mandatory over 20 units. So it is the tool that forms all of housing construction moving forward. It is the hammer in the toolbox. So I really wish we were doing this in a different order, but here we are. The analysis, the other aspect of this, we haven't done, which I asked for in 2019 and 2020, an Anne Arundel County focused housing needs assessment, not just the demographics of our population, not just the price points we need to be producing, but how we actually, and the inclusionary nature of where we need affordability, but how we actually achieve that in relationship to our land use map and our zoning code. We haven't done that work yet, but we're creating a mandatory policy that is going to, in my opinion, where Anne Arundel County is right now, is really probably going to constrain the market more than it is going to, and our housing prices, if you are in the market now and you're in a situation to retire, you're in a really good place in Anne Arundel County. But for those folks who aren't in the market, it's not great. The affordability and the housing stock available is so small. And I don't think this gets to that bigger issue. I feel like we should be having those uncomfortable conversations that have to do with really reforming our zoning code. And I am disappointed that we're not having them and we're having this conversation. I think I'm done for the day.
I just have to respond. I mean, we are having those, Councilwoman, and like if we talk about, you know, how we have been taking steps, we have a very robust funding stream for our Affordable Housing Trust Fund. We do. We've all worked very hard to get progress made on this, and I think where I'm reacting here strongly is the implication that this is the end of the line. The county executive, in proposing this legislation, does not feel that the work stops on all of those things that you talked, and it definitely doesn't stop, just like in Frederick, where they are looking at their bill over time, adjusting the knobs and changing things to make sure that the program is successful. We reviewed programs that have worked around the country, and we put this proposal together because it provides the development community, and if you recall, the 2004 legislation that we started from looks very different than the proposal that's in front of you. The structure, the big pieces are maybe the same, but the draft even that we were talking about in early parts of this summer did not include some of these incentives because of the feedback that we heard. So we have provided in this bill the ability for developers to create affordable units, a mandate that they create affordable units, but the county is putting skin in the game by providing very generous fee reductions on those units to help ensure that this does not become, the developer might make a lot less money on an MPDU unit, but it is not our intention to make sure that they don't make any money. The creation of those fee reductions are tens of thousands of dollars. The market price of these units are at the moderate level. They will still be able to return on their investment, and they will still have 90% or 85% of their development that is able to be used at market rate.
If I may, I appreciate that. I do want to point out, though, we have funded the Housing Trust Fund, and it's very exciting, and I'm extremely proud of that work. I'm very proud of that work. But in that same vein, our administrator of our Housing Trust Fund and with ACDS is struggling because of other barriers in our code to be able to use those funds to find land that's zoned properly with the right density attached to it, with all the other barriers that we're not talking about today. So while I have a list of 20 questions, and we'll make sure you get them, but maybe there's a path forward that makes sense. Well, I think there's a lot of work, I think, that needs to be done on this policy, and I think it needs more time than maybe the 95-day legislative cycle will give it, but we can have those conversations. The public hearing's November 6th.
I want to go to Ms. Rodvin and then close out with District 5.
Thank you. I just really want to push back on the idea that we don't have a handle on the problem, that we don't have data. We absolutely have data. To say we don't, I think, is a real insult to the Partnership for Children, Youth, and Family, who provides us with Poverty Admits Plenty, and ACDS, who is continually, I mean, every time I have asked for updated data, because it is an ongoing issue in the city of Annapolis, and even though this bill won't directly impact the city of Annapolis, the creation of additional affordable units is desperately needed. And if that means folks have to bounce out of the city limits, that is fine. I also think the City of Annapolis MPDU law provides a perfect example of why it has to be mandatory. I don't know exactly how long that has been in place, and I have a feeling Ms. Karpowitz does, because you were ACDS was the administrator for a while, but zero units. Every developer chose to pay the fee in lieu. And I think we can sit here and talk about, well, is this going to produce? Is this not going to produce? Let's pass it. If it doesn't produce, if we find that all development has come to a screeching halt, then we turn our attention to someplace else. But to say we're just going to sit and wait is, I mean, every month that passes and another development gets approved that doesn't have MPDU is an opportunity lost. So to sit and say we're gonna continue and just kick the can down the road, I just can't believe that we're having a discussion like that when we have a real affordability crisis. Yes, there are other things we can do. We need to look at zoning. We've also got a great opportunity to do that in our comprehensive rezoning that's coming down the pike in probably, I don't know the timeline, I won't say. I feel like in the next several months for the first few regions, but to say we need more time is I think the worst answer for affordable housing. Like this, if we could go back in time, we should do that. The second best time is now.
Right. Any additional comments? I'm sure we'll have further discussion over the next few weeks.
I think we might.
Yeah. More discussion?
More discussion.
Oh, yeah, yes. I'm going to go ahead and get to these resolutions so we can close them out. Outside of that, we're going to transition over to Resolution 4023. And then, Mr. Hunt, over to you.
Excuse me. Thank you, Mr. Chairman. Ethan Hunt on behalf of the administration. With me is Grace Tidings from the Health Department and Laura Blair-Klossmeyer from the Office of Law. Resolution 4023 would approve the county's application to the United States Department of Justice for a grant under the Edward Burney Memorial Justice Grant Program. The grant application is for $160,297. A copy of the application should be attached as Exhibit A. This grant application was submitted by the Criminal Justice Coordinating Council. Funds from the grant will be used for a case manager and paralegal in the drug court program, a juvenile reentry coordinator, as well as violence intervention strategies through Peer Violence Interruption Health Ambassador Program, and that's through the Partnership for Children, Youth, and Families. And the Sheriff's Office will also be receiving an allocation to fund a mobile app that will increase transparency and info sharing with other law enforcement agencies and communities. And we're happy to take any questions the council may have. But the application requires the council to approve the submission of the application.
Any comments? No. Seeing none. Thank you for being patient. I guess no comments is a good thing. So we will now transition over to Resolution 4423.
Okay. Joining me at the table are Kyle Roof and Bill Heiser from the school system, and Laura Blair-Klossmeyer as well. So this Resolution 4423 supports the County Board of Education's annual submission of its 5-year capital improvement program through the Public School Construction Fund to the Interagency Commission on School Construction.
Well, first I want to say, Mr. Hines, welcome back to Anne Arundel County. I did use the North County High School principal example earlier. He was the principal in North County High School about 11 years ago, 10 years ago. And so you're now serving as a COO for the school system, so I think they got a win with you. So any, Madam Vice Chair, I see your light on.
Thank you, Mr. Chairman. I'll be brief. Obviously, District 2 has a tremendous amount of school construction going on with the Old Mill Master Plan. I want to thank the school system for some of our collaborative community meetings we've been holding regarding some of that construction ongoing. I do just want to bring to the attention of this body that it's time to, we're at that 10-year point with what we call the MGT study. I'm excited. I believe there is some gentleman's ladies agreement that we will be funding a study both with the county moving forward to look at our school construction needs going on to the next 10 years and reevaluating. I'm excited to maybe look at that scope a little differently, and we've had those conversations, making sure that we are also not only looking at the age of our schools and capacity needs, but also where we need to be land banking for the future. Where is growth going? What does a school look like 20, 30, 40 years from now? And making sure we're planning for the future in a very calculated and robust and strategic way. So I'm excited to hopefully fund. That would be in our operating budget, or would that be in the capital budget?
We have a new program that we're starting in the capital budget or requesting this year, would be project planning, and that could be funded out of the capital fund.
Do you think it will be a joint funding effort from the county and the school system, or will the school system, I mean, we would potentially fund it, but
so
would it land solely in your shop, or would we collaborate?
Depending on how funding looks, it could be entirely in our shop.
It's been extremely successful in Anne Arundel County to take really the politics out of school construction, and I say that with, probably I don't know, $1 billion worth of school construction happening in my community, but it has, other communities have had their day in the sun with school construction, and it's finally landing in the Old Mill area. But moving forward, we really need to make sure that we're doing this in a very strategic way. So I look forward to that conversation. Sorry you had to wait so long. Maybe we should have a system of texting people when our meetings are going long on a certain bill.
Did you want to go?
Yeah, just have a quick question. I echo what Ms. Pickard said about MGT study, having worked with that for a number of years. I think it is one of the best examples of collaboration that the county government and all branches and the school system have done, and I look forward to the next iteration of how we'll move forward. And I also have a question. When are we breaking ground for Cat North?
If everything goes as planned, it should be earlier this spring.
Great. Thank you.
I don't see any additional questions. I will make a comment. So our county body, as well as the administration, we're going to be looking at the capital improvement program. So we got a commission or a work group that's been put together to look into that. Now it's focused on some of the county resources programs that we've been building. But I think long-term, I'll probably sit down and want to have a conversation, and hope you all are included in this, is the capital program for the school side of the house, which is probably the preponderance of all of our capital program in the first place, just to try to put mechanisms in place on the cost, because the cost of constructing these facilities has gone up drastically. I mean, we were, looking at $40 million high school. Now we're closing in on $200 million for a high school. And so the CIP program literally is a train waiting to run it over. And so we're trying to prevent that. So there's some discussions about, how we do the bidding process, how we keep the costs down. And so look forward to working with you. I have worked with Alex Chiknovid in the past, maybe 5-6 years ago. And I think he had some insight, but I think we can relook at this and find a better way to find those builders that are willing to work within the constraints that we have and still produce a quality product that we can be proud of. But I'm just planting that seed up front now, because if we can save $100 million off a $1 billion program, that's $100 million worth of money that we can now apply to something else. And so hopefully we can work together on this going forward.
Look forward to it.
Sure. All right. Seeing no additional questions, we will transition to Resolution 4523.
All right, last one. With me at the table is Lynn Miller from the Office of Planning and Zoning, as well as Lori Klossmeyer from the Office of Law. So Resolution 4523 would approve the application of Land Preserve LLC to sell an agricultural land preservation easement to the Maryland Agricultural Land Preservation Foundation. Land Preserve owns approximately 128 acres located at 3843 Queen Anne Bridge Road in Davidsonville, and they applied on June 16th of this year to the Maryland Agricultural Land Preservation Foundation to sell a agricultural land preservation easement. Map of the property should be attached as an exhibit. State law requires the county governing body to advise the foundation as to its recommendation of approval or disapproval of the application. In deciding whether to approve the application, the county governing body is to receive the recommendation from OPZ and the Ag Preservation Advisory Board, both of whom have signed off as this being a favorable recommendation.
Any comments on this resolution? Seeing none, thank you. Oh, you all had to be here anyway, now I think about it. I think we should just put your names on the seats there for future meetings. Is there any other business to be brought before this county council? All right, seeing none, may I have a motion to adjourn?
Motion to adjourn.
Is there a second?
A better second.
All in favor?
Aye.
Any opposed? Motion carries. The county council is adjourned until Monday, October 16th, 2023.
I wasn't expecting a 5-hour meeting
I know.
today. I don't know about you.
I know I didn't either. I got to get my